Hello, good evening, namaskar, sat sri akal, vanakkam, khammagani. On behalf of Childline India Foundation, I, Lena, would like to welcome all our dignitaries, our mentors, our supporters, our partners joining us today to celebrate Childline's journey of 25 years. Namaskar once again. Yes, a long journey it was. The child who received support from 1098 on day one must be an adult today. The childline team who fought with system to access justice for so many children might become the mentor of other teams today. So many success stories, so many struggles too, so many ups, so many downs. Childline ran 24 into 7, 365 days, 25 years. That is how we can say Childline, the biggest and only child protection network in India that does not require any more introduction today. And with this note, even we can say in this 25th year of Childline, all the Childliners believe from their heart and soul. The credos, like every call is important, every child is important, and Childline is a special family. Generation to generation, senior to junior, the key message passed on throughout these 25 years, those are try your best, sink or swim, and thus Childline could continue the journey for the sake of children despite the vivid social, political, and cultural diversities that exist across our country. Only good intention could work together in these 25 years. How can we forget those children who suggested 1098, the number? Children were trafficked, were lost, but accessed 1098 when in need. Children who clapped when Childline was in Satyameva Jayate. Children who trusted Childline and get access the justice in Anchorage case in Supreme Court. Children who came in contact with Childline after tsunami, after Bhuj earthquake and Kosi Phylline cyclones. Children who accepted Komal and said no to abuse. They know there is a service, people who are there for them everywhere, including in child help desk in railway stations, in bus stops, a designated team called Childline for them only. They know. And today, on this occasion, we must take the opportunity to welcome all of you who have immense contribution to create, to nurture this network. We take the opportunity to express our gratitude to the Ministry of Women and Child Development, Government of India for their support to Childline. Through our different sessions today, we will try to introspect our strengths and our loopholes to take the baton at next level. We invite you to imagine the next 25 years of Childline with us to help us grow in strength, to reach every child, to excel, to add new dimensions to our work. It is our privilege to welcome you all once again. And with this, we will start lighting the lamp and requesting Childline Agartala to light the lamp. Dr. Srilekha Roy, Director of Childline Agartala and team, please light it up. Very nice. Thank you so much, Childline Agartala team. And with this, we will move to the next session. Thank you. Thanks a lot. Yeah. And now to look back the journey of Childline. And that is why a film is prepared. The film where we have captured the voices of many people who came together to make a strong, vibrant network of today. Please have a look on the film next.
हेलो दीदी, मैं बहुत दिन से घर के बाहर नहीं गया हूँ.
ஹலோ அண்ணா, ஒரு குழந்தை காயமடைந்துள்ளதை நான் பார்க்கிறேன். நீங்கள் உதவ முடியுமா?
हॅलो चाइल्डलाईन भैया, रेशनसाठी मदत हवी आहे. হ্যালো চাইল্ডলাইন, আপনারা কি বাচ্চাদের জন্য আইসোলেশন সেন্টারে আসতে পারেন?
হেল্ল' চাইল্ডলাইন, এদল ল'ৰা ছোৱালী এজন সম্বন্ধ নথকা অনুৰক্ষকৰ লগত ট্ৰেইনত উঠিছে.
Hello Childline. Social investigation reports needed for 15 children.
June 2021 marked 25 years since Childline received its first call from a child in distress. 25 years and 90 million calls later, Childline 1098, supported by the Ministry of Women and Child Development, Government of India, is the world's largest network for child protection. As we celebrate our Silver Jubilee and 25 years of service to children, Childline India Foundation takes the opportunity to respect and salute the work, effort and commitment that comes together 24/7 in Childline.
Hi everybody, it's nice to see that Childline is 25 years old. I cannot believe it, how time flies. I still remember the meeting with the boys when they said, we need a number which is simple, thus, now, art.
Childline was started as a single city experiment in child protection, supported by the Ministry of Women and Child in 1998. The experiment was very successful. In 2009, Childline became a part of India's integrated child protection services. We went from strength to strength, and in 2014, the aspiration was set to cover every single district in India for Childline. Today, we are a part of Mission Vatsalya as a result of Childline's delivery on child protection.
At work means 1100 child protection cadre, over 800 partner organizations, 6 centralized call response centers working round the clock. We work very closely with the district administration, DCPUs, CWCs, state government, other allied system to rescue, support, rehabilitate and restore children. At present, we are working in 602 districts, also covering 144 railway stations across the country and 11 bus stands. Our ability to step in with timely assistance prevent children from falling into a spiral of abuse and exploitation.
I've seen how it has grown from a small office space in Mumbai to the whole country. Childline gave the voice to those children whose voice was not being heard.
We were determined to make the response as comfortable for the child as possible. No IVR, a caring voice in real time. Technology solutions to enable us to connect a child to a person who spoke her language in few rings.
Childline India teams have been working incessantly behind the scenes to forge seamless collaborations which entails responding to calls on 1098, connecting children to partner units for need-based interventions on the ground, representing children's voices at the state and national level, imploring for children with diverse stakeholders such as the railways and technology service providers to forge a collective response to address children's issues.
For more than 20 years now, as one of the co-pioneers of Childline, I have witnessed the Childline network across the country not just grow, but to adapt to the various challenges that have critical child protection implications, be it disasters like pandemic, earthquakes, tsunami, floods, cyclones, or critical care interventions such as in the circus case in Akola, the Anchorage case of child abuse by international pedophiles. But most importantly, children recognize Childline as a service they can reach out to in times of crisis.
Childline is a reference model globally and is also a backbone organization for the child protection system in India. Every year, Childline provides training to thousands of government functionaries in the country and also continues to build the capacities of the children, the families, the communities that are at risk to prevent, to alert, and to address child protection risks in the country. UNICEF is a proud partner of Childline, and for that reason, we want to wish Childline success and all the best for the next 25 years.
Many times when we carry out rescues from child labor or child sexual exploitations, children are confused, terrified, injured. Childline then steps in with sensitivity and counsel and is the reassuring social workers who eases their fear and anxiety. We support them through steps that could involve police actions, legal cases, or medical interventions. Most rescues involve a lot of coordination. At times, we have even had to get our teams across district to step onto a single train at different railway station along the route to rescue a single group of children being trafficked.
भी स्टेशन पर था, लोगों का सामान उठाया करता था, हमारी क्या करता था। तो उस टाइम पर जब भी हमें कोई तकलीफ होती तो एक दीदी आकर हमें नंबर के बारे में बताया करती थी और जब हम उस नंबर पे फ़ोन करते थे तो वो तुरंत आकर हमारी मदद किया करती थी। जैसे कि हम कभी बीमार पड़ गए या पुलिस हमें परेशान कर रही है या मार रही है तो वो दीदी हमारी मदद किया करती थी। तो धीरे धीरे फिर दीदी के साथ में हमें ऐसा लगा कि हमें भी ऐसा कुछ करना चाहिए, दूसरे बच्चों की मदद करनी चाहिए। तो हम भी जैसे ही दूसरे बच्चे हमें मिलते थे, उन्हें भी कोई तकलीफ होती थी तो हम उन्हें अपने साथ ले जाते थे चाइल्ड लाइन में और उस बच्चे की मदद करते थे। तो ऐसा करते करते मुझे भी खुद इंटरेस्ट आने लगा चाइल्ड लाइन में कि मैंने दीदी से कहा कि दीदी मुझे भी काम करना है चाइल्ड लाइन में। तो दीदी ने फिर मैंने 3 साल बच्चों के साथ में वॉलंटरी काम किया। फिर उसके बाद में मैं चाइल्ड लाइन में दीदी ने मुझे टीम मेंबर बना दिया और मैंने 16 ईयर्स चाइल्ड लाइन में काम किया है। आज भी बॉम्बे सेंट्रल स्टेशन पे मेरा काम है और आज भी अगर कोई भी बच्चा मुझे मुसीबत में दिखाई देता है तो मैं 1098 चाइल्ड लाइन पे फ़ोन करके उस बच्चे की मदद करता हूँ।
Putting children first, working collaboratively, building leadership among our partners. These are some of the key values at the heart of Childline. This is what enables us to fulfill our vision of creating a child-friendly nation that guarantees the rights and protection of all children.
I think what Childline does very successfully is bringing together a host of stakeholders, a host of civil society organizations who may be working, who are very strong entities in their own right, who work on a variety of issues, but who are all bound by one single mission, vision, and credo as far as the Childline work is concerned. And this social franchise model that Childline has helped establish, it's remarkable. It is remarkable and very special. It's probably the largest child protection network in any single country in the world.
Childline puts children first. We believe that keeping children safe is a large and shared responsibility of all the stakeholders across the society. Childline's values keeps me motivated. And I don't know where these 20 years have gone since I joined the Childline family.
Children may have biological parents, but it is the responsibility of the community at large to take care of the supreme asset of the nation. And one of the mechanisms to give voice to these children is the Childline. It is a system where children and their well-wishers can contact with directly, and Childline acts as a via media between these voiceless children, these powerless children, and the systems that have been put in place by the government.
जिला सिरमौर में विगत 7 वर्षों से चाइल्ड लाइन बहुत ही अच्छी तरीके से काम कर रही है। चाइल्ड लाइन के जितने भी मेंबरान हैं उनसे हमें बहुत ही अच्छा सहयोग मिलता है, क्योंकि जिला सिरमौर जो है इसका कुछ रिमोट एरिया में पॉवर्टी इलिटरेसी की वजह से या कुछ परंपराओं की वजह से चाइल्ड मैरिज के और सेक्सुअल अब्यूजेस के बहुत सारे मामले होते हैं। तो इन बच्चों को रेस्क्यू करने में ये टीम बहुत ही मददगार साबित हुई है।
The scale of reach of Childline and its outreach, I mean 2 million calls per year, how many organizations can claim to reach that kind of numbers? And the impact it has on the most vulnerable children in the country. I think it's inspirational to see them work. It's been my personal privilege to be associated with Childline for a small part of their journey and with the team at Childline India Foundation. And I want to take this opportunity to wish them all a very happy 25th and to many more to come. Call 1098.
Through Childline 1098, India has been able to demonstrate to the world the critical role that child helplines play in child protection, and we hope our model continues to inspire child helplines globally. In today's rapidly changing times, where children face imminent dangers on various fronts, by adapting and evolving new models and solutions, we strive to remain steadfast in our mission to keep every child safe.
चाइल्डलाइन मेरे लिए एक प्रोजेक्ट नहीं है, बल्कि मेरी जिंदगी का एक अहम हिस्सा है, जो मुझे हर रोज एक मौका देता है किसी बच्चे की कमजोर आवाज में अपनी आवाज शामिल करके एक मजबूत आवाज बनाने की, जो आवाज बात करती है बाल संरक्षण की। आज इस चाइल्डलाइन के सफर को करीब 25 साल हुए हैं और मुझे इस सफर से जुड़े हुए 10 साल हुए हैं।
तो सबसे खुशी की बात यह है कि चाइल्डलाइन की 25 इयर्स पूरे होने जा रहे हैं। तो उन सभी लोगों को बधाई है जिन्होंने चाइल्डलाइन में काम किया और चाइल्डलाइन को आगे बढ़ाया, और आज भी जो लोग चाइल्डलाइन में काम करके उसको आगे बढ़ा रहे हैं, बच्चों की मदद कर रहे हैं, तो उन सभी लोगों को बहुत बहुत बधाई। और प्लीज़ कीप इट अप, जितने भी लोग काम कर रहे हैं, और मैं भी काम करता रहूँगा, वॉलंटरी काम करता रहूँगा, क्योंकि चाइल्डलाइन के साथ तो जुड़ा होना चाहिए।
I see Childline developing specialized intervention units to provide tailor-made services in regions where certain key child protection concerns are endemic. For instance, in hotspots for trafficking, unsafe migration, child labor, or regions where we have high suicide rates among children and young people. These specialized intervention units would also address the emerging concerns for online safety for children.
I think we can challenge ourselves. I think we should think of ways of how we can use technology to cut costs, to reach more people, to reach the last mile. Because I think Childline has a long way to go, where the last child in the village who doesn't have a phone can still feel safe and secure and know that there is someone for me who will look after me if I'm being abused, beaten, or have nobody who is looking after me. Next 25 years, every child in India should be a child who can access Childline.
ମୁଁ ଚାହେଁ ପ୍ରତ୍ୟେକ ଗ୍ରାମ, ପଞ୍ଚାୟତ, ସ୍କୁଲ, ଅନୁଷ୍ଠାନ, ପ୍ରତିଷ୍ଠାନ ପିଲାମାନଙ୍କ ପାଇଁ ନିରାପଦ ଏବଂ ସୁରକ୍ଷିତ ରହୁ। ପିଲାମାନେ ସମ୍ମାନର ସହିତ ବଞ୍ଚିବା ପାଇଁ ସୁଯୋଗ ପାଆନ୍ତୁ। ଏଥିପାଇଁ ମୁଁ ଓ ମୋ ଅନୁଷ୍ଠାନ ସବୁବେଳେ ସବୁ ପରିସ୍ଥିତିରେ କାର୍ଯ୍ୟ କରିବା ପାଇଁ ପ୍ରସ୍ତୁତ।
So what is it that makes 1098 thus no art? Is it because the number was a number given by children? Is it because it's lasted 25 years in a changing socio-economic, cultural background in India? Is it because of the so many millions of children that it's assisted unstintingly through these 25 years? Is it because it's walked the last mile with them? I think it's all of that and more. In a day and age where the development sector is now talking about sustainability, it's talking about partnerships as being the most valuable and most critical premise for any initiative. Childline was talking about this and setting the context way back 25 years ago. That is what makes it so special.
मैं जब तक जिंदा रहूंगी मैं चाइल्डलाइन के कार्यक्रमों को मैं देखूंगी, चलाऊंगी।
चाहे पैसा मिले या ना मिले, हमेशा, क्योंकि मुझे हमेशा लगता है कि बच्चों की आवाज़ जो है वो बच्चों की समस्याएं हमारे कान में गूंजती है, और मैं एक रोशनीदाता यानी कि टॉर्च कर्ता के रूप में मैं काम कर रही हूँ, हमेशा करूँगी।
We will remain rooted in our vision, a child-friendly nation that guarantees the rights and protection of all children. We will add focus on prevention through community leadership and thought leadership among members of the child protection ecosystem. We will create spaces for children's participation and agency at community level. We will use technology to strengthen our tele-response, multiply access points to Childline, add mental health interventions, and strengthen efficiency of our back-end processes.
Yes, of course, Childline is an emotion. And with this, we will move on to the next session, and there is a poll for you. Please use the link given in the chat box and use the passcode to take part in this poll. Use www.menti.com and use the code 559793338, and please take part in this poll. Yes, we are waiting for your responses, please. Yes, we are getting. Please participate.
So please open a browser and type in www.menti.com and use the code 559793338. Your question is, what does Childline 1098 mean for the children of India? You can enter 2 or 3 word answers. Each of you have 3 options. For our viewers on YouTube as well, please go to www.menti.com and use the code 559793338.
Yeah, the code is 559793338, and you need to log into www.menti.com.
Great to see so many responses. While the screen might change, the poll will still be on, so you can keep this URL open. We have a couple of poll questions through today's session. So keep the URL on. Every time there's a poll, just refresh that page. Exiting this for now, but to continue with the rest of the session, but we'll keep getting your responses. Thank you so much, everyone.
And with this, we will move on to the next session. And now I would request Dr. Anjaya Pandiri, Executive Director, Childline India Foundation, to present a report on 25 years of Childline 1098. Sir, we are eager to hear from you, sir.
Thank you, Lena. Is audible?
Yes, sir.
Okay. So thank you so much, Lena and others, particularly Childline Agartala and all the speakers, all the key messages who given on in the film. So very, very inspiring messages. We're all grateful to all of them, and they're traveled along with us. And thank you very much. And I'm very happy to be here on behalf of my entire Childline India Foundation team. And today, it's a very, very wonderful day. And it's a very, very significant day in our Childline journey. And we are almost completed 25 years. And we're just reflecting, trying to reflect and celebrate whatever we have done, whatever learnings, whatever good practices, whatever limitations, all these things really, really helped us to shape this organization to reach to this level. So once again, thanks to everybody. And before I start, I would like to say today we have Childline directors across the nation, our Childline teams, and our founder, Jeru Bilmoria, Ms. Jeru Bilmoria, and our governing board members, respected Professor Shanli Bharat, Subo, Dr. Mary Joseph, Rajat, and many others. And we also got officials from railway officials, Ms. Kusma Madam. We have a UN representatives, Ms. Soldad, Aptab, and other friends. We have also Mr. Amod Kant, who is a good supporter and who is trying to travel along with us. And we also have a kind of joining, we have an international speaker, Dr. Venkat Pulla, and we also have a kind of honorable chairperson in CPC are also going to join in the end of the session. So my best wishes and greetings to all of them. So I would like to share with you the great journey that we have so far. So Childline is just completed 25 years. And if you look at, rightly, Jeru pointed out, some time ago in 1996, in June, the Childline was set up as a helpline for street children by Jeru. At that point, Jeru was teaching a faculty member at TSS, and she is a person, conceptualized this and thought this is a need, and she started this a small way as a kind of a field-based project to the TSS students. So in that year, we got almost 6,000 calls. So that is a kind of encouraging. That has really given a kind of idea. So this has to be, go on. I mean, go ahead. We have to take forward this, the helpline to various levels. So that is how initially it started. Then 1999, Ministry of Social Justice Empowerment came into the picture, and they looked at the need for the critical child protection response after ratification of the UNCRC. And Ministry of Social Justice initially came forward to support this. That is, as a result of that effort, in 1999-2000, Childline India Foundation formally registered under Societies Registration Act and Bombay Public Trust Act. In 2000, Childline is formally recognized with the Juvenile Justice Care and Protection of Children's Act 2000 as a very, very important statutory services where it enables Childline team members to work very closely with the kind of statutory bodies like CWC and JJ boards. So that is how this it became a kind of mandatory service to the children who are in need of care and protection. This has this has also inspired many other the global level at that point of time. And that is a time where Jeru also, I believe, she moved to Netherlands, and this other global child helplines spin out of the Childline India experience. And as a result of this, the Child Helpline International was established in year 2003. That is how this the concept of child helpline is from India, learning, taking from India. It has spread across all the global levels. Can you move? So if you look at our Childline 1098, our journey so far, if you look at 2007-18, we have first centralized Childline contact center set up in Mumbai. Then later on, it's moved to zonal level CCC from 2010 onwards. In 2009, Childline becomes part of the. This was a very, very critical in terms of reaching out all the the centralized and also reaching out. That point of time, the team worked very hard, convinced across the partners and also the ministry, and Nishit and Dennis and other members, Kajol, Nicole. This is a team who worked very hard to really bring out this, conceptualize and also bring out in formalize this as an institution. So that is how this Childline Contact Center established in 2010. So there onwards we moved on. So in 2009, Childline becomes part of the government scheme. MWC's the Ministry of Women and Child Development Integrated Child Protection Scheme. That is a part of scheme it became. Now today we call it as a Mission Vachalya. So then in 2010, 1098 gets category 1 status. That is a toll free for caller. That means the caller need not pay the money, but it's like a kind of police number and ambulance. It's easy to remember also. And this 1098 was initially this number was invented or found or identified by the children. So that's the beauty of this. So when it became a category number 1, and it also opens up all the kind of telecom services. So that is how the 1098 as a very, very significant number. So in 2010, the teams started focusing on the scaling up, and they wanted to reach out the national level, the coverage, and that is from actually 2010 onwards, the focus started on that. Then in 2015, we got into the railways. We got into the collaboration with the Railway Childline and Ministry of Railways and Ministry of MWCD and Childline India Foundation together. We started establishing child help desks in the railway stations. Sometime in 2015, August, we started this, and we started with the first level. We started with the 20 railway stations. After that, we moved out to other places. 2017-18. So we also did a service, the national mapping and review of the child care institution with the MWCT and NCPCR. That was one of the very significant study. And since it's a first of its kind study to look at the standards of care across the country. There are small studies here and there, but the nationwide study was not taken up. And this study really helped us to understand how the childcare institutions are really functioning and what are the kind of changes required into that to ensure that safety of the children at the childcare institutions. So that is how we started. Then child help was set up in bus stands during the COVID-19 pandemic. 2020, we started this new concept called, also we thought this is a kind of hotspots, and this is also very essential. And we need to also establish child help in the bus stands, and it was approved and it was agreed, and we started. Now it's currently we are working in about 11 bus stations across the country. If you look at this slide, the growth, when 1996-1997, we started two centers, and if you look at 2009-10, around 80, 100, we are in between. Then from 2014 onwards, we really scaled up, and today we are in 602 railway districts and also 144 railway stations and around 11 bus stations. So this is a kind of growth. If you look at from 1996 to this last 25 years, starting from 2 districts, today we are in 600 districts. If pandemic would not have come in, to the surface, probably would have reached out entire country by now. So, but however, this kind of plan is to reach out entire country, around 735 districts all over India. So that's the kind of plan we have in future. It's a very great effort. It's a very great thing. Also, at the same time, it's also difficult to understand and difficult to accept this. The status of the children in this country. If you look at as a national emergency response mechanism for child protection in the country, since its inception, we almost addressed about 95 million calls plus million calls answered. And out of that, we have already directly reached out to the children, around 3.1 plus million children we reach out directly. And today we have established child contact centers in 6 locations across the country. And we have 831 partners today who are running 1,089 childline units across the country. And we have about a full-time 24 into around the clock work, 11,000 child protection cadre team members are working around the clock on the ground to ensure the child safety in the country. So today we reached out around 602 districts and almost we covered about 81% of the national coverage. And we have reached out 144 railway stations, 11 bus stands. And this plan is in moving forward. Probably we may reach out to many railway stations in future to come. As you know all this, most of the directors know, most of the child and friends knows this. We have a kind of very collaborative efforts. We work in tandem with the kind of allied system. We have a kind of child and 1098. The child and 1098 service cannot be done in isolation. We have a childline advisory board on the top, where this is headed by the district administration. We have also state advisory boards, child and state advisory boards, where it is headed by the secretary, the WCD. So this is a kind of a very critical body to help us and enable us to ensure that child protection in the particular district. We have a nodal organizations which talks about the training and capacity building, research, networking, awareness, outreach, various things, documentation. It's a very important, the nodal organization also plays very important role in us. And collaborative organization is the key. It's a lifeline because where it reaches on the child, whenever the child is in crisis, whenever child needs care and protection, and it reaches out the child directly. So we have about, as I said, we have a good number of childline collaboratives across the country, and it is 24/7. This collaborative organization works 24/7, and also along with the call center and the response to calls 1098. And this collaborative organization also takes about awareness, outreach, and documentation. So it has a very important role in terms of ensuring child protection at the ground level. We have a support and district level. Basically, it's also run by the volunteer organizations. And basically, they create awareness, outreach, and case follow-up, because this is a kind of system we have. And we have a resource agency which provides necessary resources support and gives information. So this is a kind of structure we work, and this is very closely work with the kind of allied system. We closely work with the other stakeholders. We closely work with the kind of statutory bodies and statutory like CWC and JJB and even other statutory bodies and police and various like-minded groups, etc. So this is a very important the structure to ensure the child safety in the country. Childline India Foundation as a catalyst. We always believe that this is the change has to come. And we play kind of very important role catalyzing the entire system. So if you look at childline contact centers and childline program teams and other team members, they respond to the calls, 1098 calls, and call management, data management, analysis. And we have a district level and transit point childline units and district level childline help desk at railway stations, bus stands. Their main primary task is that intervention. They make interventions, outreach. They take up outreach and awareness, and they sensitize communities, children, and various other stakeholders. And also they network with they work very in tandem with the allied systems and other organizations to ensure the child protection. We have a national and state level, district level, Childline Contact Center and Childline India Foundation. This is very critical to ensure the delivery of the services on the ground. And we have an advocacy that we take up a kind of advocacy. We also taken up the scale up of this expansion planning. And we also maintain the partnership support, grant management, and training and capacity building to our own partners, own Childline teams on the ground, and also other allied systems and also other stakeholders who requires our support. We also ensure the communication and fundraising, monitoring and evaluation, and digital enabling. So these are the kind of some of the functions we play. So if you look at some of the achievements, we have several achievements to celebrate, but some of the achievements I can say, we brought out, we developed a Komal film, which is it talks about child sexual abuse. It's an animated program, and this film was translated to various regional languages within the country and also outside the country. Many foreign nations also approached us, and they also translate into their own languages, and they screened in their countries, respective countries. Komal also got a best award, national award by the ministry in the category of education, best education, and so we also Railway Children Service Child Help Desk. That is, as I told again, in 2015 we started child help desks in the railway stations with the support of railways and MWCD, and we also kind of, as I said again, national mapping. That is also very important milestone in our work. And we also, this is very interesting, we also talked about Childline Knowledge Hub. This is set up in 2017, basically to make sure that we'll be able to reach out our partners and other stakeholders, even the ecosystems, child protection ecosystem. We wanted to want to take up the capacity building, and we want to also take up the policy advocacy research, and various things are happening. And initially we got a very good support with UNICEF, and with the support of UNICEF, we have taken up this kind of activities. And also their master trainers were trained under this with this support. And as a result of that, we are able to train at least 20,000 teachers, on the under NISTA program with the Ministry of HRD. So this training is also really helped us to talk about various things. The many teachers have been trained on the child protection, and particularly with the focus on the child sexual abuse. And Childline 1098 is declared as essential service during the pandemic. Last 2.5 years, it's a really hard times for everybody, and particularly for the Childline teams on the ground, and also Childline people, Childline teams at the various levels. It's very tough time, and we never closed down our office, and we were always the day one onwards. We have been on the ground, and so therefore it's essential service. Declaring as essential service also enabled us to do some good service to the children and the communities and the families during the crisis. 2020, we set up a child help desk with the bus stands, and as I said, it's a growth. You have seen the previous slides. You have seen the growth, how the growth was there. Yeah, move on, Ganga. COVID-19 response. This, as you all involved very intensely. Everybody was alert, and everybody is really contributed hugely for the minimize the risk of this pandemic. And Childline also played very important. Childline 1098 declared as essential service, and we have distribution PPE and relief material. And we also assisted migrant travelers by Shramik trains, and during the first wave and also during the second wave. And second wave, we also tried to provide access. We are trying to bring access to the healthcare services. And we also look at the communities and district administration, linking of the communities to the district administration, government departments, to ensure that various entitlements and the provisions, they will get into the kind of things. So we have a new initiatives towards excellence. This is a kind of a future we are thinking about. We wanted to focus on the technology. We have already started a case reporting system. We are just in a kind of pilot mode, and we are using mobile app for this purpose so that the load can be reduced from the on the partners side. And we also learning management system, which is basically kind of a tool which we wanted to online learning system we are developing. And we already started with the kind of our own stuff, and we're reaching out to our Childline partners across the country. And we have developed child vulnerability map some time ago, and that is going to be live in future. And we are working towards the technology where the people can get a kind of access to the information, the child vulnerability whenever they want. So we have a grant management system. You know that particularly our directors knows that we have been streamlining. We have streamlined most of the things in terms of grant management. But however, we are going for a kind of online grant management system in near future. The technology, the software is already developed, and just we have to try it out, and we have to trial and error base. We have to pilot it, and we have to launch this in a full-fledged manner. As for the program interventions concerned, Child and Knowledge Hub in partnership with the UNICEF, that is a kind of a backbone now. We are going to reach out, and many new programs we are going to take up. And we have already initiated research initiatives we have taken up. Capacity building is going on. And also we wanted to reach out, the strengthening the entire this Child and Knowledge Hub with the support of the UNICEF. PCCR is one of the innovative program. We started in a kind of pilot base in 7 railway stations, and to just see that how best we can strengthen the scale of this thing. And this support is received by the Ajim Premji Foundation. We are working in this PCCR program with the Ajim Premji Foundation support. Child Protection Committee Strengthening Program. This is a new. It's not a new, but we are just trying to refocus on this. And we wanted to strengthen child protection committees at the village level. We wanted to work, we wanted to enable, and we have to activate the various systems, various key stakeholders on the ground, to like PRIs, communities, schools, things like that. So we wanted to strengthen this program, and we have started piloting this in some states. Special projects on endemic issues at the regional level also we are starting, and that's going to be there, and with the support of various donors, and that's how we are moving in future direction. Looking at the future, the way forward, and we are just thinking about internally. We wanted to, we already established some strategic goals for the 21-26, but we have 3 major strategic goals. One is engage every child in the country. I mean, Childline should be accessible. Childline 10 stories to be accessible to every child. So we wanted to create a multiple child-friendly space across the country. And we started child help desks in railway station, child help desks in bus stands. Like that, we wanted to identify hotspots, and we wanted to establish child help desks to specialize and to meet that requirements. We wanted to also enable the child protection ecosystem. We wanted to work and strengthen our hands, and also we wanted to work with this Childline network as a source of building capacity and knowledge of the large ecosystem. And we wanted to ensure that work in closed system with the kind of allied systems and also other stakeholders at the ground level across the nation. Childline is a kind of trusted source of evidence-based insights, because we have a data, but that data is a very sensitive data. But we are very carefully using this, how best we can strengthen this, use this data for building research, and also then find out the solutions according to reduce the vulnerability of the children in the country. We wanted to look at our internal system. We are looking inside. We wanted to build our organization as a kind of choice for the committed to working for this protection of the children. And also we wanted to build our institution a very, very strong to reach out every corner of this country. So we wanted to also, Childline India Foundation is a sustainable, we wanted to sustain ourselves. We wanted to focus on the resource mobilization. We wanted to focus on our capacity building inside, internal capacity building. So this is the way we are looking at forward, but we'll come out with a clear plans in future. So finally, to everyone who has been part of our Childline family, we wanted to express our deepest gratitude and very sincere thanks. Firstly, we wanted to support Minister of Women and Child Development. We wanted to thank the Honorable Minister, our Secretary, who is the chairperson of the CF Governing Board. We have a joint secretary who is a management committee chairperson, and we have a kind of finance advisor who is a member governing board, and along with other members, we wanted to thank them for their continuous support and encouragement in our work. We wanted to also thank Department of Telecom for everything they do it. We wanted to thank Minister of Railways, NCPCR, SCPCR, state governments, allied systems at various levels. We wanted to thank UNICEF, Ajim Premji Foundation, and other strategic partners, various donors who are supporting individuals and also corporates, institutions. We wanted to thank them. Very, very heartfelt thanks we wanted to express to them. Finally, we wanted to express our sincere gratitude to all our governing board members who are really, really inspiring and time to time, and we are trying to travel along with us and guiding us all through our journey. We wanted to finally, without CF directors, CF team, Childline team members on the ground, directors, and CF core teams at the national level, regional level, without them, it would not have been successful. And they are the kind of backbone to make sure that, whatever we are doing, whatever achievements we are celebrating today, these are the people who are, who are the instrumental to achieve all these things. Finally, we would like to express our, gratitude to the children of India. And this is very sad, but we need to really, really, because they're in a vulnerable situation. That's why we are existing here. And we wanted to see that we wanted to reduce the risk and minimize the kind of vulnerability of the children. That's our effort. So thank you very much for this time, and also, presenting to all of you. And it's a great privilege standing before you, all of you, and sharing our journey and sharing our thoughts and sharing our, the significant achievements that we made so far. So thank you very much for everyone, and every one of you, particularly directors and Childline teams on the ground, and my own colleagues, my own team members, at the regional level, at the national level, and also other members. Thank you so much. Thank you so much.
Thank you so much, sir. With this detailed report and with this welcome note and everything, it's really thankful to you. And now it is time to hear from our founder, Ms. Jeru Bilimoria, and would like to request Ma'am Jeru Didi to share the opening remarks on Childline's journey, thoughts for the future. Over to you, ma'am. Ma'am, you are mute. Ma'am, please unmute. Yeah.
Now can you hear me?
Yes, clearly.
Super. Always doing crazy things. Okay, first of all, I have to say this is a really emotional moment for me, because Childline was a dream and now it's 25 years old. So it's really, really emotional. And I cannot even say anything, because basically my first thanks goes out to the kids who gave the idea. I still remember the crazy Chachaka Melas where we would have 4,000 kids, and when they would go home, they always said, but now what? There's no one even for us to call in the night when the police comes to beat us or when we are sick. So I always say Childline is rooted in what our kids gave the values. Our values are based on the street kids who made our shape what Childline is today. So when I was hearing the song, That's Not What, Child Mein Mere Saath, that was the first thing. And I say thank you to the kids for helping shape the model of Childline as it stands today. I want to thank all the people, and Dr. Anjaya, I'll first start by thanking you. I know you're unwell, and yet you have been there for all your support. So thank you very much for everything. Really, thank you, and take care of your health. That would be what I would say. But as I go, I would like to thank everyone, and you've done a great job of thanking, but I'm going to go historically. So bear with me for 2 minutes over here. Our street kids made it possible. So I think they are the ones who and what you all may not know is the first service which we had, our whole research was done by street kids and pictograms, because they wanted to tell us what they wanted the service for. So we need to remember the power of the kids. My second most important point I would like to say is, do you all know why Childline was national? Is because the street kids traveled all over India and they wanted the same number, because otherwise it wouldn't be there. So I think we need to remember in all this to continue listening to the kids, not just with phone calls, but in our outreach and in everything that we do. I want to thank the kids who were there, Masjid, Manohar Das, Ansari, all of them who helped build all of this. Next, I would like to thank, and I want to make special thanks to the 3 initial team members. Meghna, who was the first student, Prakash, and Nicole. They were the 3 pillars in making this forward, and Nicole's still there. So for everyone, I want to give a big hand to Nicole for everything that she's done. And then you will be hearing Kajol, you will be hearing, I don't see John, but John who was there, and a lot of other team members. And I just want to say, it started with this passion, but it has gone on. It's so nice to see Harleen, Chitra, so many of you who are still over here in the whole team who have spoken. Dennis, I can go on, but I can't mention everybody. And I do want to say Childline is what it is for 3 reasons. The kids who believe in us, the partners, the NGO partners from day one who have been the core, be it Yuva, be it Father Plasi, be it Father Adolf, be it all the partners nationally who believed in us. So I would say it's Mrs. Rane, everyone who believed in us right from the beginning. So it's the kids, the partners, our team members, 11,000 strong, and last but not the least, the government which is there, and all our board members who have been cores, Dr. Desai, Mr. Mirza, Rajat, Ranjan, who is no longer there, who shaped the logo and the designing. So everybody who believed in us. I say this because historically we need to know the people who have built, who have shaped our teams, who have been part of this journey. And Childline is everybody. My worry as we go forward is we should not forget we are for the kids on the streets. We are for the kids in rural areas. And somewhere I think we need to get that spirit back. I say this because it's me, and I apologize. Even as we celebrate, we have to self-reflect. Our calls are shifting from kids to adults. We need to get back to empowering our kids. And therefore I was suggesting, Dr. Anjaya, don't murder me for this, and the whole team, don't murder me for this, or don't get mad at me, but can we revive everything by starting on June 20th, 2022, if COVID permits us, to reigniting Childline Se Dosti, the street fairs that we had. If we can reignite that, I would be really, really happy, and have June 20 as Childline Se Dosti Day all over India. And let's start by thinking about every single Childline center doing outreach, getting kids, having fun, having a party, and putting children right at the center of child protection. I would love it if we could make this happen, and that be the defining moment for the next 25 years. And using technology as a core, getting every one of those children to see each other and making sure that that happens. It will cost us a lot, but why not still make that happen? I'll put in the first amount to make this a reality. So if we can, to every Childline partner, let's start with June 20, if COVID permits, if everything permits, to reignite Childline Se Dosti and reignite children who are our core to be the center of everything that we make happen. Thank you very much. I see Rajat on the screen. He's been phenomenal as a board member. So I just want to send him a big thanks for everything he does behind the scenes. Thanks, Rajat. And thank you all. You all have been phenomenal. Let's make the next 25 years even more phenomenal. Thank you.
Thank you so much, ma'am. And with this spirit, we need kids, we need Jeru Didi always with us. And to move on to the next session, we would request Ms. Kusuma Hariprasad, ADRMA, Southwestern Railways, Bangalore Division, to share some words on strengthening children's participation, Childline's partnership with the railways. So would request Kusuma Hariprasad ma'am to please.
Am I audible?
Yes, you are audible, ma'am. But you are not visible. Can you open your camera, ma'am?
Yeah, I'm open. It is not. It is a host has asked you to start your video 1 minute. I'll start in 1 minute.
Okay. We can listen you, ma'am. Please. Yeah.
You can see?
Yes. Now you are visible. Yeah. Thank you.
Yes, very good afternoon to distinguished dignitaries and all my Childline participants in this August gathering. It is indeed a proud and privileged moment for me to be associated with Childline India Foundation 1098, which is dedicatedly involved in 3 R's: rescuing, reuniting, rehabilitating the children who are separated, trafficked, misguided, and runaways. I take this opportunity on behalf of Indian Railways to congratulate the entire team of Childline India Foundation on its Silver Jubilee celebrations. The Childline India has played a vital role in reuniting almost lakhs of children with their families and has brought smiles on so many distressed families and reviving the lives of children and still contributing relentlessly. Railway were rescuing the runaway children discreetly till Childline India Foundation joined hands with Indian Railways in the year 2015. Since then, the railways have been actively involved in noble cause of reuniting the dedicated, dislocated children to their families. Presently, Child Help Desk is functioning in 144 railway stations to ensure the care and protection, security and well-being of the runaway, unaccompanied and trafficked children. Since at presently, I don't now. I'm working as ADRM Bangalore, and I don't have data for Indian Railways as a whole. Now I will talking about data available with me about Southwestern Railway, which has got consisting of three divisions: Bangalore, Hubli, and Mysore. About the Southwestern Railway data, I'm analyzing. How Childline is working here. About that, I'm talking about now. The Childline help desk in functioning in three railway stations in Southwestern Railway, which are one is at Bangalore, Karnataka, Kasangolli Rayana station in Bangalore. Its station level partner is Basco and Ajim Premji Foundation also providing additional fund to this unit. In Yeshwantpur railway station, it is working with station level partner Sati. In Hubli station, it is working with station level partner Belgaum Diocesan Social Service. On analyzing the last 3 years data of Southwestern Railway Child Help Desk, we have rescued almost 6,890 children, even though in the last 2 years, the passenger train services were badly affected due to pandemic. Out of 6,819 children, 830 children are girls' childs. The traced children are identified mainly from Bihar, Uttar Pradesh, northeastern states, Andhra Pradesh. Shockingly for me, especially since I'm from Karnataka and I'm working in Bangalore, 1,000 out of this 6,819 children who are rescued, 1,708 children run away from North Karnataka and they came to Bangalore for search of job opportunities. On analyzing the age pattern, it is observed that majority of the children are in the age group of 12 to 16. When the child help desk staff Bangalore and railway officials interacted with these children, it is learned that most of them had come to Bangalore in search of job, either family dispute or prey to child trafficking. Majority of such children are traced in the trains like Danapur Express, which is coming from Patna, Tinsukia Express, that is coming from Guwahati, Prashanti, again it is coming from northeastern side Orissa, Amsafar Bagmati Express Delhi, and Kurla Express Mumbai. Southwestern Railway is proactively working and supporting child help desk in rescuing and reuniting children. Some of the important initiatives taken by our railways are, now I am going to tell. Firstly, we have facilitated child help desk by providing suitable places on the platform to set up child help desk at free of cost. Station masters have been empowered to meet the incidental charges like providing food, beverages, and other necessary items to the rescued children. Southwestern Railway is also creating awareness to the passengers in coordination with the child help desk by displaying child help line numbers on platforms, station entrance, booking counter, and other prominent railway premises. And also, we are making announcement in public passenger announcement systems. Railway is also joining hands with Childline for celebrating children-related special events in station premises. Railways have permitted the child help desk members to screen and interact with the suspected passengers on arrival and departure. And railway officials like already we have informed and advised these TTs, RPF police person, GRP police person, and other stakeholders like vendors, shopkeepers, cleaning staff who have been sensitized regarding the child rights laws and responsibilities on rescue, and also their work accordingly to railway SOP. RPF wing of Bangalore division has launched a program Nanne Farishte for rescuing children more than 760 children have been rescued and handed over to child help desk. Monthly meetings are being held with the child help group to ensure its smooth functioning. In Yeshwantpur railway station, railway has created child-friendly space to help the child help desk. Based on our experience, I would like to suggest some suggestion to Child Helpline India. We have enough data to suggest the trend of child trafficking and runaway cases. Child Help Desk is also aware of the same. It will be prudent and meaningful if the screening of such crimes is carried out intensively at the originating station itself and also en route from where these children are being brought. The child line 1098 needs to be advertised widely so that the common public is made aware like the other helpline numbers 100 and 108. Railway have now resumed its full passenger services because due to COVID it was not fully operational. Now it is resumed back full passenger services. Therefore, the passenger movement has also increased. In wake of this child help desk, this needs to be set up in more number of stations, including wayside stations in the suburb of the city. Parents and persons accompanying such children needs to be counseled and also made aware of the legal actions and repercussions under human trafficking. Runaway and trafficked children should be counseled and career counseling should also be extended to such children so that they do not fall prey to such malaise again. They
Yes,
should
yes.
also spread this to the people in their place of safety.
Yeah,
The
thank you,
person
ma'am.
who are trafficking, this is very important. The person who are trafficking and accompanying such children are usually left free after the child is rescued. Hence, identity of such person should be widely circulated in the child help desk groups and railways group to keep an eye on such person to take action and prevent such activities in future. And we have planned some future action plans for strengthening the rescue of children in Bangalore railway station. Just I'll read out 5 points just for your this information. This, already RPF, TTE, station masters are actively participating in the child rescue. However, other railway officials will be advised to be more vigilant and alert so that they can also assist child help desk for rescuing children. Bangalore division of Southwestern Railway has approached already UIDAI to set up Aadhaar Seva Kendra at 8 railway station as
Ma'am,
a pilot project. Yeah.
ma'am, with a humble
Yeah,
request,
yeah. They
actually,
have
time
agreed.
is the
We are also
constraint.
agreed. We are doing this. What?
Yeah, time is only constrained in the online program. So, but we are
I'm
really
telling
grateful to
two
you.
points only I'm telling. See, no, this is also critical point I'm telling. We are already set up in Aadhaar Seva Kendra to 8 railway station as a pilot project. This will help child help desk to establish the identify the rescue the children and their parents. One more initiative we have done. We are planning to rope in colleagues and college students for spreading awareness and popularizing child helpline 1098. In this regard, already two colleges, one is prestigious Reva College of Bangalore and St. Claret College also they have agreed to participate and spread awareness through poster, boards, street plays and paintings and cartoons. Okay. Okay, fine. Since time constraint, I'll thank and I'll express my heartfelt gratitude to Childline India Foundation for giving me this opportunity for sharing my thoughts, and I'll also congratulate Railways as well as Childline India for doing a commendable job of humanity. Thank you.
Thank you so much, ma'am. Thank you. All the suggestions were very pertinent. Only the time is the constraint. And so we need to move on to the next session. And to know on Childline's role in the child protection system, we would like to hear from our next speaker, Ms. Soledad Herrero, Chief Child Protection, UNICEF India. So we would request Sole ma'am, please to continue your speech.
Good afternoon, everybody.
and as well as Dr. Jero, colleagues, representatives from the Ministry of Women and Child Development. I understand that Mr. Kanungu, person of NCPCR, is also going to be in this very exciting session and very exciting day where so many things to celebrate. And it's really the pleasure of UNICEF to be part of this Silver Jubilee celebration of Childline. I really take the opportunity to congratulate all of you for having reached this important milestone. The first thing I would like to say as UNICEF is how much India Childline has really become a global reference and a global model that many countries that are also having similar models, and we know that there is also the global Childline, and how much other contexts and other countries are really learning from all the efforts and endeavors that Childline India Foundation has taken on in the last 25 years. And I also, of course, want to congratulate the team in the first place, but as well to recognize the Ministry of Women and Child Development of India for having embedded this important architecture within the child protection system in the country. I think over the time, and there's been a lot of moving reflections today, Childline and the number 1098 has really become the synonym of a hand to lift up those children in distress. And personally, it's been an incredible experience in all the field work or field visits that I've had the opportunity to have, to realize that I'm yet to find one child in India that is not aware of what the number 1098 represents, which is very, very telling considering the almost 500 million children that live in this country. I was asked to reflect on a Childline within any architecture of a child protection system. And I think globally and as UNICEF, we've learned that for a child protection system to be successful, at least 3 elements needs to be in place. First of all, a child protection system needs to be grounded in communities. It needs to be agile, and it needs to be put children at the center. And I'm guessing that everybody that is in the call, as I've been saying that, have been thinking, well, this is exactly what Childline is about, and this is exactly what Childline is so important in the context of a child protection system. There's been the statistics shared today with, I think, over 80% of India covered by Childline services. I think there is around 600 cities, over 144 for railway stations, and now also the work that has been expanded in the buses as well. That really has allowed Childline to reach the last mile and reaching the children that are really needing it the most. Childline is extremely agile, and that we know very well, and we've all had the privilege to see Childline in action. And I think really this model that is a private, public, that has the child centers with a network of organizations that, again, are indigenous to the areas where they operate, allow them a high level of flexibility, high level of responsiveness. And I think it's very important also to recognize how critical and what role they can play in avoiding over bureaucratic, over legalistic approaches to difficult situations that children might face, which really leads me to the last point of how much Childline really live up to the principle of the best interest of the child and putting children at the center, starting from how the number was chosen for the children, by the children, and the incredible how the entire engineering and the entire architecture of the system, as well as the philosophy and as organization
it really puts children, and those children that are the most vulnerable, the most excluded, really at the center. And I've also been personally extremely touched. I had the opportunity to visit the center, and even the sensitivity with which the calls and the patient, and I had an opportunity to listen to one of these silent calls, right? Where children that are in the most difficult situations just have nothing else around them, but you know, they do reach in the phone, and how the childline professionals handle that and really comfort the child until the child is able to express their feelings and express what is been happening to them. For UNICEF, it's really been a tremendous privilege, and we've also, even more so in the context of COVID, where the situation, you know, it was unprecedented crisis for everybody, and really seeing Thailand living up and growing up to the challenge, seeing across the 14 states where we have field presence, how all the teams mobilize, how they didn't hesitate for a second to expand and continue doing outreach despite the difficult situation, including or especially during the second COVID wave. It's been a tremendous privilege. We've also had the opportunity, you know, in the context of COVID, to work together in the area of mental health and psychosocial support that we know that has become so critical and so visible in the context of the COVID-19, that has really increased the grief, the anxiety, and the isolation of so many children. And we've also had the privilege of supporting Childline to, again, live up to the modernization and, you know, keeping up with what is very important for such a big, titanic organization that really demands having in place modern information management systems that can serve well the incredible work that the organization does. I do, before I conclude, want to really extend my special gratitude and acknowledgement to all the frontline workers, including the many frontline workers from Thailand that they might not be able to actually join us today because they will be probably on duty. So you are the soul of this organization. And again, for UNICEF, it's been really a privilege to see how the organization has grown, has expanded, has become more professional, more relevant. And, you know, we really wish the best to Childline for the future to come. Childline is not a child anymore. It's become a 25 young, strong, level-headed, well-intentioned, and very driven young organization, which I'm sure will continue to yield a lot of public good for the country and for the children that they need the most from all of us. Thank you.
Thank you so much, ma'am. And actually, our Childline team also listening to you, and all your support actually keeps us motivated to be relevant, to be significant. And with this, we are moving ahead to the next session. And for inaugural address, would like to request Professor Shalini Bharat, Director, Tata Institute of Social Sciences and Governing Board Member of Childline India Foundation. So, would like to hear from Shalini ma'am. Professor Shalini Bharat, ma'am.
Thank you. Thank you very much for inviting me, and I'm so glad. Childline 1098, world's largest national network for child protection services, is celebrating its silver jubilee. It's 25 glorious years of providing child protection services for India's children in need of help and support, all those children who are in distress and living in dangerous situations. At TISS, Tata Institute of Social Sciences, we are extremely proud that the service began at the institute by a student, Jeru, who also later joined us as faculty. And this was a result of a student's fieldwork, and which was further shaped up as a pan-India service. At TISS, we feel this model shows the value of education that is provided at an institute which has always believed in classroom learning blended with community engagement, field-based learning. So kudos to you, Jeru, and of course to Team Childline. It's heartening to see the service grow from strength to strength, and for which I congratulate Team Childline for their dedicated service. As we can notice, there are so many firsts that Childline can boast of. In fact, I've been reflecting on this for some time. In COVID times, we have seen the power of telephone helplines, and across country, a free helpline, the support of technology, and the power of collaborative actions. All this was already the feature of Childline. In 25 years ago, they thought about, connecting over technology through the aid of telephone, and given the children the ability to connect with, the police. And then it continued during its 25 years journey, and they kept adding and kept making it even more sophisticated. What is also a matter of great satisfaction that the Government of India, the Ministry of Women and Child, understood the value of such a service, the uniqueness of this model, the uniqueness of this very child-centric model, and gave its full support to scale it up for children across the country. And this is all because the country's commitment is to CRC that recognizes children as individuals who are constantly growing and developing and need support for bringing out their full potential, for realizing their full potential, and to prepare them for a full life in a free society. And TIS continues to remain committed to the goals of child protection and well-being, and to be by the side of Childline as an important stakeholder. We are also committed to reducing the risks and vulnerabilities of children, and to making it possible for developing them as responsible citizens, and to empower them. On behalf of all our colleagues at TIS, as the director, it's my pleasure to congratulate you all once again, and for giving our best wishes so that we are able to go forward. As we move forward, we're able to contribute in a more and more significant way. Due to my other commitments, I'm sorry I'm not going to be able to continue, but thank you once again for giving me this opportunity, and good luck to Team Childline.
Thank you so much, ma'am. Thank you so much. And we would like to hear more messages from our governing board members. And so would like to request Mr. Subonenba Longkumar, Chairman, Community Educational Center Society, to share a few words.
Okay, thank you so much. I would like to congratulate Childline India Foundation on this 25 years of celebration in the service of, to the nations, in particular to the children. As a GP member, I congratulate and acknowledge Dr. Anjaya Bandari, Executive Director, and the team, and all the partners across the states and the district, all over the nation. I'm grateful to our Chief Minister, Governor of Nagaland, and also Secretary Suyolva, Chairperson ISCAP of Nagaland, for acknowledging the service of Childline in the state on this 25 years of anniversary. We are thankful to our CIF Regional Office, Mr. Sandeep Mitra, and also Avik Mitra, in the team for continuous support to all the partners in the Northeast. Even during this pandemic, the Childline team has risked their life protecting the future of the children and the children of this country. Your sacrifice, to every Childline team members, your sacrifice and selfless attitude has made this nation a safer place for children every day. You are like an angel of the day, which can be seen, which can be touched, which can be, which can be felt, which makes everything possible, for the children every day. Every Childline that is functioning in this country has, has lots of problems, challenges. But in the context of like Northeast, we have very strong customary practices that prevent legal services, lots of legal services, and also the institutional problem that's involved dealing with lots of issues on children. But however, the presence of Childline in the state, especially in this region, the face of Northeast is transforming positively, especially towards the care in protection of children. wherever there's a presence of Childline in the districts and in the states, the Childline is hitting all the child protection partners, stakeholders in capacity building, in advocacy, and child protection, rescue, and all sorts of child protection, missions. The presence of Childline is also bringing all the child protection agencies together. That includes police, that includes government agencies, NGOs. So we are always in the forefront when it comes to children in the state, in the district. In the state, Childline has supported and initiated, especially in Nagaland, by developing a child protection policy, which will be implementing in 1,900 government schools with the education department. So these are some of the key roles and very important roles that is opening the hearts and minds, especially even with the government officials. So we have a long way to go. Once again, our battle is not over yet. We have a long way to go. It's just 25 years old, very young, very energetic. We are very, we have, our presence and number is great, and we have a great mind. We're a strong team. Therefore, let us fasten our belt, motivate one another, and continue to move ahead. As we celebrate this 25 years of Jubilee, we should be always reminded that our service is needed much more than yesterday. So let us look forward. I congratulate all the Childline team members, all the board members, officials of Childline, and also government agencies, and also stakeholders that support Childline. Thank you, and heads off to all the Childline partners. Thank you so much, and God bless us all.
Thank you so much. Yes, truly spoken that we have a long way to go together, and that is why we would go to the next session. We would request our next speaker, a government board member, Dr. Mary Venus Joseph, Dean, Rajgir College of Social Sciences. Ma'am, over to you.
Thank you. Can you hear me, please?
Yes, yes.
Yeah, okay. I am really privileged for two reasons. One is that I am part of the Silver Jubilee celebrations, and second is part of this great movement. That is what I want to bring it to your notice. Now, let me also give my jubilous Silver Jubilee greetings to all of you, to Jeru Bilimoria, our founder, Mr. Dr. Anjaya, Harleen, Chitra, few names which I remember right now, all the other heads of the regional units, other team members, the governing board members of the former members and the present members, the directors, coordinators, team members of the partner organizations, the volunteers, and so on. The list goes. All of us, rather. Definitely, we all deserve a big applause at different levels. Now, over to Jeru Bilimoria. I remember meeting her maybe late 1980s or early 1990s during my occasional visits to TAS's campus on academic visits from Rajgiri, Kochi. Seen her as a young girl, maybe she has just completed her graduation and into the fieldwork assignments, or rather a young lady, very energetic, but little did I realize that Jeru was a mastermind in bringing a revolutionary impact in the country by having Childline India Foundation as the umbrella agency for the care and protection of children throughout the country. So I'm really proud to say that at least I know Jeru. Whether Jeru knows me, I do not know, but at least I keep saying that I have met the founder years back, and I'm really proud of such an acquaintance. Glad to see Jeru on the platform today, and also the suggestions you put forward on having 20th June as a day to be remembered, so the children know what are they part of, and of course to bring them on the national digital. Now, but quickly I'll just give my observations on two things. One is the two government schemes for the care of child welfare, protection, development, and so on. One is the prestigious ICDS, the National Integrated Child Development Service Scheme, and the second one is the our Childline India Foundation. ICDS is definitely conceived as a government program with a government missionary way back in 1975 on 2nd October when it was launched. Pure government missionary, and definitely it has got a coverage all over the country, which definitely we should be proud of. But on the contrary, Childline India, Childline is an initiative. Now we know how it has been initiated, and initiative of people like you all, the volunteers who have come in. Maybe we have brought in a machinery, a framework, but basic of all this is that the passion to bring in protection or a care for the children. So that is what I want to highlight here, that it is from there we have really worked out so much. It is a great stride over 25 years. And if you are closely watching the presentation by Dr. Anjaya, that shows that we have really covered so much. And there is so much scope ahead. I think we'll have to concentrate more on research because we have accomplished so much. Maybe we can bring in more of research also into it. I'm extremely proud that such a meaningful program has been chalked out. My kudos to organizers. There's something really great. You have brought in so many people here. And I'll also wish if something is done at the regional level so that the different state partakers can get closer so that they also feel happy. Yes. All the more happy if it is offline, but I won't say that because still we are under the COVID restrictions and also the government fund, the ministry fund. Okay, so I stop here. Again, thank you for the opportunity given to me and appreciating all of you for this great endeavor. Thank you, I remain. Thank you.
Thank you a lot, ma'am. Yes, hope for the best. We are also expecting that offline programs, those conferences, those workshops, this meeting together. And but all our Childline team, all our partners are eagerly waiting for our next session because we need to move on from inaugural session to thematic session. So to close this inaugural session, I would request my colleague, Mr. Vikas Putran, Head Resource Mobilization, Childline India Foundation, for vote of thanks for the inaugural session. Over to you, Vikas, sir.
Thank you, Lena. I would like to thank all the speakers, Jeru Bilumoria, Madam Kusuma, Sole, Subhona Longkumar, Dr. Joseph, Professor Shalini Bharat for all our governing board members for their messages of encouragement and appreciation that they have showered on Childline. I'd like to thank the Minister of Ministry of Women and Child Development, the Secretary, Joint Secretary, the Financial Advisor and Ministry officials of MWCD for their unflinching support through this journey for facilitating our mission to help children. Thank you to the Ministry of Railways, the RPF, GRP, thanking all the stakeholders, including state governments, police, district officials, and other allied systems. I would like to thank the entire Childline network and team members for taking part in this event and for your dedicated service and valuable contribution through the years. I would like to thank the CIF team led by Dr. Anjaya and his team for producing this event. Would like to thank all the service providers, Coconut Media for their support and technical assistance. Would like to thank all the alumni of Childline and most importantly, the children who have reached out to Childline and sought help. I would like to thank Nicole for the founding team of Childline for helping us execute this event and for the valuable contributions to Childline over the years. Would like to thank our donors, volunteers, and supporters for standing with Childline all through this journey. You have been a great inspiration for us and help us do every day serving more and more children. Thank you, everybody. Picture abhi baki hai. Please stay on. We are moving into the next sessions. So hang on with us.
Yeah. Thank you, Vikas sir. And with this, we need to start our thematic session. And the first session would be on Childline Value Adds to Child Protection, 25 years. And this session would be chaired by Mr. Rajat Gupta, Member of Governing Board, Childline India Foundation, Senior Partner, McKinsey. And the panelist would be Father Maverick, Director, Caritas Goa, Mr. Vasudev Sharma, Director, Child Rights Trust, Ms. Kajol Menon, former Executive Director, Childline India Foundation, co-founder Leher, Mr. Sandeep Mitra, Head Services, Interim Church, Childline India Foundation. And with this, we will start our first thematic session. Only request to brief the session. I mean to have the speech on brief, just to keep on the time constraint. Thank you. Over to you, Rajat sir.
Thank you very much, Lena. Delighted to be here. Maybe I'll just start with a few words of my own observations of Childline and why I feel privileged to be associated with it. I have 4 points to make, and then I have one piece of advice for Childline and for many of you who are listening today. Clearly, this is a priority and a critical service that we provide to our young citizens. So the criticality of this can't be questioned, right? I mean, in a country like ours, which is in its own way very chaotic, and where services of this kind are really hard to deliver, given the width and the breadth of the country, as well as the magnitude of the population, this is a critical service. Now, as I said, I'll talk about 4 things which kind of make me proud about you and what you are doing with and for Childline. The first is the large touch that you have. I understand that you're touching 10 million children a year through your various programs, 1 crore a year. That's a lot through your education programs and other programs. I understand that you touch 2% of India's children, which is quite amazing. Childline receives 5 million calls, 50 lakh calls. That's amazing. And the 4 lakh interventions that you make is incredible. Imagine 4 lakh children in our country who are helped and assisted. The second thing that I would say is the coverage and the magnitude of Childline. It's obviously come a long way from the day when Jeru founded it. 600 districts, 141 railway stations. I think more importantly, the fact that it touches 1,100 of not-for-profits, NGOs in our country, and that there are people within this who are providing the service and also through this process getting aware of this issue or making us aware of this issue as well. And 11,000 people within these NGOs and the Childline Foundation who are making this happen, right? So the coverage, the magnitude of the operation itself is in itself something that makes me feel privileged to be associated with it. The third thing I would say is the fact that this is an exemplar in many different ways. It is the first social franchise organization, perhaps the largest social franchise organization of its kind in the world. The fact that 180 countries have been inspired by it, some of the earlier speakers also talked about it, and the fact that it actually projects India's soft power and the ability to develop models for large-scale models that can be adopted elsewhere in the world. Again, as an exemplar, it's something that I feel privileged to be associated with. The fourth thing that I would say is the low-cost operation that it runs. For the magnitude of the number of people that it touches, the number of people operating the system, the fact that a single touch of a child is costing a maximum of 50 rupees, less than that probably, and that an intervention costs less than 4,000 rupees. A physical intervention, which means that most of these are physical interventions, which means that there is somebody showing up to some place to assist a child, and then there are many more people getting involved. An intervention that per intervention, the cost being less than 4,000 rupees. And of course, all of this includes the cost of maintaining the call centers, the large touch with the 1,100 not-for-profits, many of whom are here today. The low-cost operation that it runs makes me feel privileged to be associated with Childline. Maybe there are a few points in the future. I would say you are low cost, but can you get to 75% lower cost through the use of technology. So that's a challenge that I would pose in front of can we reach 10 times as many children for 10 rupees a pop as opposed to 50 rupees a pop, right? Technology has advanced a lot. There may be new ways of doing this. Can we do more with less? Can we increase our impact and our reach? And then finally, can we measure our impact in a more tangible way and be able to outline what our impact is? Besides, of course, the interventions that we make and the outreach that we make to children, which are critically important. But if we take a full view of distress amongst children, what proportion of distress are we addressing? Is it 2%? Is it 20%? Is it 80%? Can we think about it differently? So with that, again, I say I'm privileged to be associated with Childline for the last several years. And I thank all of you for the opportunity, and I'm proud to be associated with you. Over to you, Lena.
I would request the next panelist to speak on this. Can I request Father Maverick Fernandez? Father? Yes.
Yeah, this is Father Maverick. Somehow, I don't know, my camera is not coming on.
No issue.
Can you hear me but no?
Yes, yes, we can listen.
Yeah, I'm asked to speak on how Childline adds value to the child protection mechanism. I would like to compare this whole issue of the child protection mechanism as a vehicle that goes across with children. And in this vehicle, we find the CWC, we find the police, we find the CCIs, we find the Child Protection Commission, the victim assistance units. And in this context, when I was thinking how to present the value that Childline adds to this Childline child protection mechanism, I have tried to look at it in 4 different ways. I would like to see Childline as a cog of this vehicle, because without the cog being so crucial, the rest of the mechanisms that exist gets difficult to function, the vehicle to move ahead. Who will bring the cases to CWC? Who will bring cases to the police of children? Who will take the children for rehabilitation in CCIs? If the systems of the vehicle are not functioning well, who will report the matter to the Child Protection Commission or the victim assistance unit? This is where Childline takes its role and forms like a cog there. The other aspect, I would like to look at Childline as the fuel of this vehicle. The fuel, because it makes the systems move ahead. Because without fuel, if it is in reserve, there's a danger that the vehicle will stop in in a few kilometers. And Childline keeps connecting all these existing child protection mechanisms, because it is through this Childline organization, the various team members, volunteers, and all the people connected with good well-wishers of Childline, the dostis of Childline, make these systems also move ahead. So as a cog, as a fuel, and another aspect I would like to see it as also an engine of this vehicle of child protection mechanism. By engine, without you cranking the starter, the vehicle doesn't move ahead. And that's where the other systems that exist, for it to crank ahead without a case being brought to a Child Protection Commission or a Child Welfare Committee, it will be difficult for the Child Welfare Committee to even take cognizance, or the police to take cognizance of a case. So this is where we find Childline playing a very crucial role of a cog, of the fuel, of the engine. And obviously a vehicle requires a driver, a driving force, and the committed, passionate team members, volunteers, the staff, the allied systems come into place in order to drive this vehicle ahead of protection mechanism. So in a gist, we can say for this child protection mechanism as a vehicle to move ahead, Childline functions as a cog, a fuel, an engine, and as a driver in the driver's role. It is a voice to the children, and the children find Childline a very support brother, a support sister, because that is the way they relate with the staff. They call Bhaiya or Didi. And so they feel very at home, a family. The language that they used, the language that the children use towards the staff members makes them as a family. So a child receives a family through Childline. Childline becomes part of a family for them. And that is how we feel that the Childline has been an important organization in this whole protection mechanism. And finally, I would like to say that the role of the government as vis-a-vis the Childline is also very crucial, because without a support from the government to this Childline organization, it becomes
Father,
difficult.
but just for the time constraint, I would request just to short it. Yeah, thank you, please.
Yeah. So I will wind up there. Thank you.
Thank you, thank you. And with this, we would move to next director, our Vasudev Sharma, sir. Please.
Thank you. Greetings to all of us for this glorious 25 years of Childline. Organizationally, being part of Childline 10-8 for the 15 years, and personally for the past 20 plus years, I see Childline has added value to many of us for many of our interventions. So in the field of child rights protection, upholding child rights, Childline being a very huge platform for all of us, moving from national level to local level, it has helped a lot. When we talk about the Childline and motivate people to call 10-8, when the CCC people lift the phone and response by the second ring, I always feel that sure, we have got another ambassador. We have got another person who will certainly call Childline to inform about children in need of care and protection. Probably at this occasion, we have to always remember the link from a common man or common person who calls CCC, that is 10-8, and the CCC personnel who receives the call and transmits to the our field people at the city level or at the local level, and the responses we give. That is the biggest link, that is the value that has been added. Being a prominent link in the JJ system, we have to thank the government for bringing in Childline in the very definition itself in section 2.25 of the JJ Act, where it says Childline services. Probably that's another biggest value added. And I wish in the coming amendments to the Juvenile Justice Act, we have to see that the child protection mechanism, whatever our father Maverick said, all these has to be clearly brought in, and some more value will be added to the whole idea of child protection when it becomes a household material. The very important aspect of calling Childline or being identified with the Childline, that in itself is adding a lot of pride to organizations, individuals, and children. Yes. I want to bring here 2-3 elements. For example, in Bengaluru, in the year 2021, we have received 2,611 calls, reported calls to the Childlines, and about 1,268 interventions have happened. This shows the level of penetration of Childline entering into the communities, entering into the people's mind. The government here in Karnataka is very responsive, and we have been interacting with the ICPS, with the CWCs, Education Department, etc. So this has happened. Again, this value has been added because of the field level legmen, what we say, who face the situation, who are intervening into the situations. just 15 years ago, I know how the Childline was being treated, but we, all of us joining together, we have lifted the face, we have lifted the cause, bringing in and impressing the government system, the police, the women in child development, the ICPS, the health system, the local corporations, etc. We have to thank again both government and Childline. The biggest link here I see is the capacity building that has happened time and again. The capacity building for people who attend calls, who attend the interventions, who handhold the cases. I mean, we can go on giving examples, but I just want to highlight one case here where in Bengaluru, the Childline team members are being seen as support members. That has added value to the child protection systems. I know the time constraints, but I would like to add one more element here is that the agenda of the Childline is actually getting doubled, tripled, and it is getting multiplied every year to come. The last 2 years in the light of this COVID, all of us actually were on our toes to take up responsibilities. I just want to respond to one of our earlier speakers about the way we have to imagine our programs is that every time new challenges are coming in, that means new strategies to be developed. I know we have to record, document all the experiences from every nook and corner of this country where we are reaching out. Secondly, we need to get into deeper interventions. I mean, here we have to get into taluka level, we have to get into panchayat level, and we have to see that we have child protection representatives at the Grama Panchayat level in the coming days. It can be in the name of Childline or it can be in the name of ICPS, but we have to reach out to the lives of every child who are in need of care and protection. I thank you on behalf of all the Childline fraternity in Bengaluru and Karnataka and congratulate everyone who are part of this. Congratulations to Jerobilu Moria and all the other people who are part of it. All the best.
Thank you, sir. And with this, all of your words, each word is very precious and valuable for us. Only the time which is poking me, and that's why I'm maybe disturbing you too. But we are eager to listen to Kajal ma'am now. Please, ma'am, share your words. Ma'am, unmute.
A big hello to the Childline family and namaskar. I think it's a very, very emotional moment to come back for the 25-year celebration. But as Leena is behind all of us, better stick to the topic. And how has Childline value added to child protection in the last 25 years? I think Jeru spoke about the spirit of Childline and the history and philosophy. Sole spoke about the architecture in which it has become a major force of intervention. Rajat spoke about the cost-effective nature of Childline and how it can be still further brought down. And I think Father Maverick, Vasudev, each shared their local kind of. So I'm just going to quickly, delve into a few from my past memories. I don't even know where to begin. But all I know is that with the first call to Childline, a set of child protection actions are enacted. Whether it's the Juvenile Justice Act or whether it is the education system, the health department, they are all pulled into action. And so Childline really catalyzes actions from every entity, those who are directly or indirectly charged with in the responsibility of serving for the protection of children. I think Jeru has already spoken about it. Childline, right from the beginning, has placed children at the center of the service. And therefore, it is at the center of child protection. And I think right from its design phase, much before children's participation and children's agency has gained currency, Childline really realize the resilience, the grit, as well as the wisdom of children. So whether it is in open houses, taking their feedback, or in the outreach programs, or in their personal cases, their participation, it has been, I think, a momentous value add to child participation. Of course, the PPP Act, I think the model, everybody has spoken about it. This partnership with the government of India and Childline, fraught with so many kind of love and hate, is a big, big value add to child protection in many ways, because it plays a pivotal role and pivotal support, as also, financial commitments, as also in the governance. But being an arm of the government, as well as being the voice of the children and Childline CSOs, it's a lot of jugglery that one has to do. And managing all these contradictions, I think, has helped the Childline service become adaptable, become flexible, and become a very robust service. And it's a serious value add to the child protection system. And as speakers ahead of me have mentioned, it is now considered a critical intervention. Child helplines are considered a critical intervention in child protection. And there are about more than 180 countries that have learned from this initiative. It's mentioned in UN high-level meetings. It's mentioned at SARC as well as at CIVEC meetings. I would also like to say that I think Childline, much before its time, sort of, made technology work for children. Much before, maybe a couple of years before the BPO, the corporate India started off its BPO run, Childline was wiring up the national service with a table and 2 telephone landlines. I think a lot of us will remember those days. That was also technology. Of course, we moved far away from that, and we moved on further to, working with the telecom department, the BSNL, the MTNL, the TRI, the public telecom services, and drawing them all in as allies for the protection of children. And I think that's a big, big value add, because it is converting the unconverted.
Yeah.
And of course, TCS has now converted, and with their TCS support, now we have the CCCs in 6 places, and I'm not going to get into that. But some of the lesser known value adds, which I would like to sort of rejig our memories, is the Childline Advisory Board, as well as the NICP, the National Initiative for Child Protection. For those of you who may be new and may not have had, the CAB is a sort of a cross-sectoral advisory group consisting of social workers, government representatives, the who's who. And, it's sort of the PRI, the police, things that Vasudev was talking about, which forges a sort of a macro connection that seeks to converge different elements of the child protection system. NICP, on the other hand, mainstream the protection of child rights into all government systems, local, district, state, and the national. And I think we coined a new term, at least it's no longer new, the allied systems. Basically, it would love to collaborate with in order to strengthen child protection in India.
Yes. And
of course, 2 more minutes.
Ma'am, 1 minute.
1 minute.
Yeah,
of course, I cannot end without talking about the social franchisee model, which we used to call it the brand add-on model. The Childline partnership, as we all know, is a mosaic with multiple points of contact with children, youth, volunteer, academic organizations. So this brand add-on model, basically, the partners delight in working through a decentralized yet integrated, local yet national, and one brand with multiple identities. A secret sauce to the success of Childline in many ways. Truly, the partnership is more than the sum of its individual parts. With this, thank you all, and really, really privileged to have been here. Thank you.
Thank you so much. Thank you so much, ma'am. And not only thank, with love, with gratitude, and be with us always. And with this, moving to Shondipda, Sandeep Kumar Mitra. Sandeepda, please
Okay,
start.
thank you, Lena. So it's really emotional moment having Jeru here, Kajul, and all the old timers here. So this is my 23rd year in Childline family. So it's something I'll just talk based on my personal experiences, which I feel the value add which gives the Childline. Like thinking about a number 25 years ago, the utility of the technology for the children was itself a value add. So we now, after 25 years, we see where we are. So when we started Childline, it was like we wanted to make it everyone's business. Like Kajol said about NICP, makes child protection everyone's business. That was the core to it. And we have been able to create a cadre of child protection workers across the country. Another thing which I think has helped us was the branding. Branding is not just a number, it's not just a logo, it's not just a color. It's all about the child friendliness. It's all about the child friendly, protection environment, child abuse free area. So another thing which we have been able to do was creating the biggest child protection network across the country, the safety net, which we call the PPP model, the social franchisee model, which Kajol was talking about. Then another thing I really appreciate, we always Jerry used to say, childline kiska hai, childline bachcho ka hai. बच्चों का समस्या उन बच्चों का समाधान. So it's the participation of the children in this entire child protection mechanism was somewhere. We did the open houses, the children used to evaluate us, monitor us. We have we took the voices of the children to the cab meetings. We brought the children to the cab, and we have the bal munch and all other aspects, like taking the voices. बच्चों की समस्या बच्चे खुद हल करते हैं, उनके द्वारा बोला जाता है. That was something which was really a innovative thing. And also another thing which we had to go through was the strengthening the CP mechanism at the ground level, like having the cabs, having the block level cabs, the membership in DCPC, and all the SCPCs, the state level advisory boards. And also Childline from the very beginning emphasized on the case management. Like we have the common case management protocols, keeping in mind all the laws, legislations, rules, policies. Yes, there are regional variations, but the basics are always the same. And as Zeru said, reaching out to the last mile, that is what we have always tried. We had the rural model, we have the sub centers in the blocks, we have special programs with the tea gardens, coastal areas, Indo-Nepal border. We have the preventive activities. And last but not the least is when the environment is hostile, the perpetrators become very active and the children become most vulnerable. It is in this point of disaster I'm talking about, where we immediately not only provide relief and psychosocial support, we also try to create a child protection environment. And COVID-19 has shown us what a great we had never been locked out, and what a challenge it was. It was something where all of us, the ministry, MWCD, the state administration, the district administration, we were declared the emergency service. The team members, the CCC members, the IU members, they were all in the field. Yes, unfortunately, we lost many of our close, near, and dear ones. But I would like to end with a small statement from Martin Luther King. Human progress is neither automatic nor inevitable. Every step towards the goal of access to justice requires sacrifice, suffering, and struggle. The tireless emotions and passions concerned of dedicated individuals. So where we are today is due to the efforts of the passionate and dedicated individuals who worked collectively, and they became the co-workers and the co-travelers in our 25 years journey. My
Thank you.
salute to all the co-travelers.
Thank you, Shondipta. And with this, we can say Childline values to child protection, and you people, all of you, actually values to Childline and total CP system. Thank you a lot. And with this, we will move on to our next session. Thank you to all our panelists. Thank you, our chairperson, Mr. Rajat Gupta, for chairing this session. And with this, we will move on to our next poll. There is a poll again. You will receive the link in your chat chat box. And who are in YouTube, please use the same website www.menti.com and use the same passcode and for the next question in the poll. So Ganga, over to you.
I've shared the link again. It's popping up on your screen. It's the same link as the previous poll. You can either go to www.menti.com and enter the code 5597938, or you can click on the link directly in the chat box for the ones on the session. We have one more question following this. So just stay on the link, please. For those of our listeners who've missed the previous questions, we will be sharing the link to the poll once again. It will be live for about a day, so you can share your responses then as well. Thank you everyone for the responses. Hang on to the link. There are a couple more questions coming up later. You can continue to post your answers away.
And now it is time for the next session, next thematic session. And this session would be on Childline Rises to Challenges in the Pandemic. And this session would be chaired by Mr. Mohammad Aftab, Child Protection Specialist, UNICEF India. And as panelist, I would request Professor Joydev Majumdar, Executive Director, JPISC, Ms. Harleen Walia, former Deputy Director, Childline India Foundation, Ms. Chitrakala Acharya, former Head Services, Childline India Foundation, and Ms. Anuradha Vidyasankar, Head Regional Resource Center, South Childline India Foundation, to come up and to join this session. Over to you, sir. Aftab sir, over.
Thank you, Lina. And it's really lovely to see the panel's member, and it's easy that when you know all the speakers. So we have got 30 minutes, and without further ado, as a chairperson, your work is very easy. So I will not take much time, only 2 minutes. Lovely to see Jaydev there also on screen. Harleen is there, Anuradha is there, Dr. Goswami will also there. So very quickly that we all know Childline has really played a critical role during the pandemic, both first phase, second phase, even the latest Omicron phase. So it has been. And not only in COVID, also in many other emergencies, whether it's Gujarat earthquake or many other after that. So now the question is that what Childline has done during the COVID, and we suppose anything happens like in future, how as a Childline we are prepared to respond in such emergency, whether it's a pandemic, natural disaster, or conflict. So that's the questions we are looking at. We know Childline is really providing critical service. So first, whether government, state government and central government, disaster management authority recognize Childline as an essential service. We know in the second ways, many of the state government has issued letter and declared it as an essential service. But I guess this is the right time to advocate at national level under Disaster Management Act or rules or circular. It should be recognized as essential service. So whenever it required, they will have a special access to the community they serve. So that's first thing. Second, do our Childline workers who are on the front line do have the protections gears, PPE, in context of COVID, but in future, whether they have the required tools, protections, that's one thing. Second thing, COVID has also shown us that many times when the physical outreach is not possible, we all need to really depend on the technology. So how far the technology integrated in our system and our workforce really able to use that technology to provide services. So with this, I will not take much time. Jodheda, Harleen, Anuradha, Chitra, and Dr. Goswami is also there. So I will suggest 5 minutes per speaker, very quickly to the point, and then we will move the discussion. So here we go, start not in particular order, but since on the top of window that Jayadeva is there, so may I request him. Jayadeva, 5 minutes.
Sir, unmute, please.
Yeah, after a long time. I request all of you to kindly excuse me. I mean, if I got disconnected. Hello.
শোনা যাচ্ছে
Okay. Actually, I'm a remote part of Chattogram in Bangladesh. It was very difficult for me. Someone helped me to get to somehow connected. Yes, COVID had a disastrous impact on every aspect of our life. The first COVID took away the income security, the food security. The second one is more disastrous. It took lives. Many young men I have seen, they passed away. Third, through which we are passing on. But Aptab, I find a little silver lining too. That is, during this COVID period, from March 2000 onwards, everything was closed, but Childline never. So that is the trajectory. I mean, the people's trust. That is why Childline is so much trustworthy to people. Government didn't function. No local government came into being. All community power structure were defunct. It was only Childline. So that stood by the people. A few experiences which I have seen. I have been driven through. That is, yes, I admit that the rescue operations could be taken up because mainly the interested rescue operations and the inter-districts too. But the CIF took a very prudent decision that provide them with support like food, sanitation, water, etc. Now, those who had some kind of a entitlement, yes, they were getting some support from the government. But the stations in Asansol, the stations in Malda, in Howrah, we have witnessed many such children who didn't have any entitlement. They remain outside the periphery of the support service of the government. It was the Childline which provided this support. The second one was very important. as the UNICEF representative mentioned, that the children suffered a lot in their psychosocial, I mean, in the i- i- some psychosocial problems they had to they faced. Yes, the no play, no peer group, no schools, and the Childline developed a module, translated it into Bengali, and then provided the training. It was a rigorous training to the Childline team members and the caregivers of the CCIs in West Bengal. There are about 72 CCIs in West Bengal. And it's a big resource pool of around 500 or 600 persons. And that is a major achievement, I would say, that this resource pool will stay. It's a sustainable approach. During this time, West Bengal was unlucky enough, we had to face the huge Amphan tornado. It lost lives. I mean, properties, people were devastating impact. The safe spaces in the coastal belts, the 5-6 districts were badly affected. The safe spaces. That was an emergent need during that time. Again, it stood by the people's trust.
Dada, 1 minute. I'm sorry, I will be a strict
1 minute, yes.
timekeeper. I'm so sorry if I
okay,
offend in that process.
Okay, and one more thing I mentioned, that during the COVID period, the gender-based violence, mainly the growing incidence of child marriage, Childline collected this information from its data and drew the attention of the government, the commission. And the commission and the government developed a SOP and for stricter vigilance of arresting child marriage. It was an achievement because it was a Childline who provided this information and augmented the entire process, the advocacy related issues with the government. That was a great achievement.
Yeah.
The telephone counseling with a long-standing partner also provided the psychosocial, psychological, emotional support to about 2,000 such children interventions calls from 61 telephone Childline centers in West Bengal. So,
yeah, sir, my humble request, sir, humble request for the
yes,
time.
yes, yes.
Yeah, sir.
Yes,
30
yes.
seconds, Dada.
After I finish,
Yes,
after
yes.
long days I'm meeting you, Kajol is here, Jeru is also there, Dr. Jayas is also there, and it is a great moment for us. Let us have a big dream that we'll sail through. Thank you, Aftab. Thank you.
Wonderful, Dada. You have joined from Bangladesh while you are make time. So now I will request Harleen. We all know no introduction. She herself very well known to everyone. So Harleen, again, for you 5 minutes, 4+1, max.
Yes, warn me at 4 minutes. I'm very difficult to
I will
stop.
do. This will be the sign, okay?
Very
Okay, go ahead.
difficult to stop when I start talking about 1098.
I will make
Namaskar.
sure that. No worry.
Namaskar, everyone. And just for old time's sake, remembering all those millions of presentations and briefs which were created, I'd like to share my screen and share what for me symbolizes Childline during the pandemic. Can you see it?
Yes, it's visible. Yeah.
This is it. I think this for me is what Childline was during the pandemic. The fact that it declared within the very first few days that the pandemic was announced that we are not locked down. And why is this so special? It is so special because I recall that the three critical elements of any CP system working, child protection system working, which was shared by Sole earlier, I recall the very first being that the child is at the center. Because the child was at the center, nothing stopped the calls. Whether it was upgrading the standard script, whether it was changing our online learning activities with children, whether it was addressing the issues of the team because the child had to be reached, whether there were campaigns being launched to cheer teams, whether there were provisions being made to register cases on websites. All examples of how Childline was determined that come what may, COVID or no COVID, no child can feel helpless and alone. To augment this further, there were WhatsApp videos in 22 languages made, which was circulated across the country, just to give the simple message that we are not locked down. Further, if you speak about agility, what bigger example than the pandemic and what Childline did? I think the fact that the entire training process went online, the fact that the focus on psychosocial support was brought in almost overnight. Manuals were created, resource materials were created, training was provided, NIMHANS gave TOTs and master trainers were created. Simultaneously, the caregivers, the network, there was sufficient care taken to ensure that their concerns were addressed. And so there were more than 17 webinars on self-care of caregivers, so that, again, the central person, the child, was safe. Not just agility in terms of training online, but technology. Childline realized through the pandemic, saw it as an opportunity that whatever we do in the future, technology has to be very, very strong and intrinsic to all our work. So the case reporting system, the learning management system, the child protection concerns map, which mapped calls across the country, was all an example of that. And thirdly, of course, besides the agility and the child at the center, was the core, which is the community. Childline, not just through its network, but through its outreach, through its awareness, is embedded deep in the communities in which it works. Nothing exemplifies that more than the campaigns and the awareness that was created. And I mean, it was heartening as well as an eye-opener for those of us who were working with Childline at that time to see that we were reaching, more than 9 lakh children within the first 5 months in 2021. We were reaching more than 30 lakh children and 44 lakh adults with simple messages of how to keep safe, with simple messages of how to reach out to 1098, come what may, and we'll be there for you. I'll leave the rest of the intricate details. You haven't got your 4 minutes, so I'll stop the share now, and I'll leave the rest of the details to my colleagues, Anuradha and Chitra, who will tell you more.
Hey, wonderful. Thank you.
Thank you very much.
Nice, excellent presentation. Harleen, is we are not locked down. It's really profound and powerful. So now let's move to the another exhibition. Chitra, very familiar face to Childline. Over to you, madam.
Yeah, thank you very much, Aftab. I think at the outset, I'd like to say it's an absolute pleasure to be back here with all the Childliners. It's been 6 months and brings back a lot of memories. While I think Harleen has spoken about the systemic interventions done at various levels, I'd like to say 4 points. One is, I think during the pandemic, though it was a complete lockdown, Childline's Connect with Children did not stop, because be it reaching out to children in CCIs through virtual platforms, physically reaching out to children in the community, street corners, that continued unabated. That's the primary goal. And like we say, disaster response and emergency assistance is in the DNA of Childline. So irrespective of the situation, we have responded. I still continue to feel the we, so we've responded appropriately as per the requirement. Second, I think, was leveraging partnerships. Childline has done that to the hilt in terms of be it engagement with the partner network through the virtual platforms. I think we have leveraged it like nobody else. Partner and the Childline India Foundation teams also capability building, which Adeline has spoken about strategic consultations with partner networks, which was like a long time dream. After many years, we were able to reconnect with partners. So that's something which we really optimized. Thirdly, also the resource network in the ecosystem. I think resource organizations, Thailand partner teams have reached out to communities and children for relief supplies, for linkages to health services, the other players in the ecosystem, other resource organizations. I think we've seen this as an opportunity to reconnect and optimize existing resources to help children. So that was the second thing. The third thing, which I think also is engaging with the key stakeholders. Despite lockdown, we have heard about the Childline Advisory Board and the Child Help Group meetings by the previous speakers. There were references wherein we've had online meetings which were made possible surely by the grit and perseverance of Childline teams to pursue with the allied systems, to impress upon them the need to stay engaged, to stay on board with what is required at the moment. I think ease of mobility, the efforts that Childline teams have done at the ground level, when I say connect with children, it's not only to reach out to intervene, it's also to seek permissions, IDs, passes for restoration of children within states, interstate. So I think that was a huge value add-on which we've seen in the pandemic, and thanks to the administration which responded so beautifully to the needs as they emerged. So I think this is something that we really leveraged to a large extent. And I would say in one line that the Childline credo of Childline cannot work alone. Childline truly believes, and I think in the pandemic, the Childline network and the foundation drew in all the players, and where required, they stepped in to help the children. So these are some of the key points, and I'd just like to say congratulations to the entire Childline team, all the Childliners who are with us in this meeting, all the ex who are probably watching this program, across the shores also, because we have a lot of our Childline ambassadors abroad as well. So I would like to congratulate each one of them for having walked this journey and made it what it is today. So thank you, and all the very best. More power to all the children of India and the Childline network, which stands for their cause. Thank you very much.
Thank you, Chitra. Really, talking from your heart, and also sticking to time. Now, face of Childline in South, Anuradha.
Thank you, Aftab, for bringing me here along with the others in this group. And thanks, Harleen, Professor Sir, and Chitra for putting in the main points and making my work very easy. So I'd like to start my sharing with a simple case on the field, basically during the pandemic, when we found a desolate, lonely child sitting in a station and crying and lost. So the Childline team there rescued the child, cared for her basic needs, and then provided her a lot of confidence and produced her in front of the committee, Child Welfare Committee. So the committee called and summoned her parents. So the parents by this time had separated, and they came with their newfound partners. So when the parents tried to cajole the child to, go back home with them, she refused, and she made a decision not to go with them. And she cited saying that I have been rescued by Childline. They have given me a new lease of life. I'm sure they'll care for me and let me have my future with, them. So this is how the Childline teams on the ground have brought children out of distress by their mere care and, building hope, and their support has been really valueless. So the point I'm driving here is Childline service never sleeps, and it is always there. And just like Harleen said, it is not locked down during the pandemic, and not just the systematic part of it. And then Professor Sir talked about, the value add to the partners through the training and so many other things. And Chitra was talking about the various nuances that were basically there during the pandemic time. Now, I think also Sole was talking about the psychosocial part of it. And here I'd like to basically give another example from the field where we received a call on another helpline, basically, and that helpline referred to Childline, that a child was feeling suicidal and gave us the number. When we tried calling back this number, the number was switched off and we were not able to reach out to the child. And then quickly there were 2-3 child lines in this process which were involved, as the story goes. And then the first child line contacted the police, and they were able to find the location, the tower area from where the call came out. And then slowly we tried and then get a lot of information, and then it led us to AP state, Andhra Pradesh state, where the child's family lived, because the phone was taken from there. And then when we reached out and then found the family, and we were able to collect the details of the child's family in Chennai. So next, the Chennai child line tried and reached out to the child, all within a few hours of time, to see if the child was safe or not. So this is how child lines have been working very hard and working with other stakeholders throughout the pandemic, and making it, the child first kind of a policy all throughout. Coming back to the rhetoric, I mean, I won't say it's a rhetoric, because when people say when the going gets tough, the tough get going. However, I would like to state here that while we were studying the calls made to Childline and wondering, like, where were the calls coming from, because the lockdown created a lot of hardships. Children did not have their support system, the networks that they would usually have, and what was working and what was not. So we found that there was more than 7.2% more calls through outreach done by the Childline teams on the ground. So it was 24% the previous year, but this time it was something like 36%. So I think the Childline teams work harder than ever before and created this impact. And they identified the vulnerable children, the most vulnerable children, and provided them with a lot of support. And coming back to the system.
Thank you, Anuradha.
The last point I'd like to make is we turned this adversity into an opportunity by working closely with all the systems. And there were several guidelines and directions right from the Supreme Court to the Ministry of Women and Child Development, to the state government, to the district administration, who pointed out to Childline as an essential service, an important service, emergency service, and to bring in children from outside to the system and help them out. Thank you so much.
Thank you, Anuradha. Thank you. That's a really heartening story. Through a story, you tell that how the Childline really stand up in the time of adversity, and particularly in second wave, I have seen myself. So as a moderator, I have to summarize. So we'll not take more than 1 minute. Quickly take away, I think that will be really the commendable work Childline and the whole family. And Chitra said the Childliners has done. I think it is a worth documenting lesson. What's the lessons we have learned while working? Not only the good things, also some of the things which we can learn from our area of improvement. That one thing. Second, the advocacy point for all the key leadership of the Childline to advocate with the government to include Childline as part of the disaster management, to have as the essential service. They recognize it as an essential service, part and parcel with health and other sectors. Third, very important that while the frontline workers day and night working there with the community, with the children, we also need to find out the ways, particularly when they work in pandemic or conflict or natural disaster, their emotional well-being. So what kind of emotional well-being we can provide for them. So these are the three, I think, take away from. One, the digital, we talk about how to integrate, make that if suppose physical contact will be impossible, how this, in fact, project started with this technology, telephone, that point of time, there is there. So let's see that in next phase, how we can really use digital power for case management and better quality. With these words, once again, thank you all the panels member, Jayadevda, Harleen, Chitra, and Anuradha. Sorry for cutting short you. This was the really pressed time. Once again, all the fraternity child line here. Thank you and happy birthday and Silver Jubilee Mubarak. Thank you.
Thank you.
Can we take 10 seconds and say congratulations because I took less time? Is that okay?
Yes,
So
yes.
बहुत बधाई,
Yes.
बहुत
Badhai. Yes, bilkul.
and
Badhai ho.
more strength and more courage in the many decades ahead.
Wonderful. And that's perfect frame for photograph. So please take photograph for your sharing with your network. All 4 of you are in the framework, ladies.
Yeah.
And I'm also in the corner. Thank you everyone.
Thank you.
Thank
Thank
you.
you so much. And it is
Thank
really badai ho aapko bhi, and congratulate to each other. And with this, we are moving ahead. And thank you, Aftab sir. Thank you a lot. And thank you all panelists, James sir, Harleen ma'am, Chitra ma'am, and Anuradha ma'am. Not only for the children, we know how tough the pandemic was for all the frontline workers. It was difficult times, and we lost many of our childline family members. And it is time to remember them. Requesting Ms. Punita Buddhiraja, Head Regional Resource Center, Childline India Foundation, to lead next. Ma'am, over to you.
भावपूर्ण श्रद्धांजलि उन सभी चाइल्डलाइन कोरोना योद्धाओं के लिए जो हमारे बीच नहीं है आज. When the pandemic came, the whole nation was locked down. Childline frontline workers continued tirelessly putting their lives at risk. Many got sick and lost their lives. Today, we together pay our sincere condolence to the COVID warriors of Childline who have departed from the Childline family, but will always remain in our hearts. Their work will never be forgotten. We will now play audiovisual to pay respect for our beloved colleagues from Childline who lost their lives during the pandemic. Dear colleague Dipesh, please play the video. We shall observe 1 minute of silence for the departed souls. Thank you. बहुत बहुत धन्यवाद.
Thank you, Punita. And we are moving on to our next session. And this session is basically with Childline, the way forward. And for this session, we would request our honorable chairperson to session this to be chaired for this session. Respected Sir Mr. Amod Kant, General Secretary, Prayas, JAC Society, Joint Coordinator, NITI, NITI, CSO committees. So, sir, we are eager to hear from you. And to join you in this session, I would request all the panelists, Ms. Rita Panikkar, Director, Butterflies, Mr. Nishit Kumar, Managing Director, SBCC, Mr. Chinmay Mahapatra, General Manager, Azim Premji Foundation, Mr. Dennis Rodriguez, Head Childline Contact Center, Dr. Anjaya Pandhiri, Executive Director, Childline India Foundation. I would request all the panelists to join. And Sir, Amodji, Sir, over to you.
Welcome. Thank you very much. I think it's a historic day, and being in the company of Rita, my old friend, Dennis, Chenmoy, and Nishit, and Anjaya Pandiri. Well, I'm really delighted, very happy, and go back in the memory. Rita, you definitely recall 2nd October 1998. That was the date Mahatma Gandhi's birthday, when 5 of us, 5 organizations, Butterflies, Salam Balak Trust, Delhi Brotherhood Society, Don Bosco, and Prayas. We all of us were together, and for the first time at the national level, the program was launched. Prior to this, as you know, that it was in existence earlier, and there were 2 centers before that, 1996, 97, 1998. These 5 organizations of Delhi, they started Childline. The journey has been very, very hazardous, very pleasant, very challenging, and very, very interesting. You can well imagine, starting from that Jahangirpuri where we started it off. Today, 93 million, what a number. 93 million children have been touched, I mean, they have been affected by it. And as you say that nearly 30 million, 35 million, that's the number of India's children in need of care and protection. That figure we give, 3.5 crore. That's the number that we have directly touched in past 25 years. So it's a great day. It's a wonderful thing which has happened. And of course, in between, whatever has happened, I can recall almost everything, but time is short and I have to hear the panelists also. But briefly stated, I would like to say that in the thousands and thousands of cases, because Prayas runs 164 centers now in 10 states of India, we have got 6 helplines that we are running. So I have seen all that stuff. I mean, starting from Delhi, the street children of Delhi, whom we have rescued in thousands of them. I recall that when tsunami took place in Andaman Nicobar Islands, I happened to go there. And that time, I think the minister was, some lady minister was there, she was with me. And of course, I recall that in Raxaul, on that border, maybe 1,000 children were rescued by Childline primarily. And one doesn't know how many children have been rescued and rehabilitated. Childline has become perhaps the prime mover. Today, if you recall the entire system of trafficking and child labor, juvenile justice system, the 1098 is the thing, the most important thing. It's a critical factor in all that stuff. And that is something where when it fully justifies the position that 1098, a Childline, is perhaps the only voluntary setup which finds mention directly in a law. Juvenile Justice Act of 2000, it makes a mention of Childline. I mean, no other NGO is mentioned like that, the way Childline is mentioned today. So it's a great job we have done, and I'm very happy to see Jeru, Nicole, Harleen, Aftab, all of us, old timers are there and new timers, and in between so many people there. I think today when we are here at a particular point, before the panelists to speak, 1 or 2 points I would like to highlight. Number one, as said earlier, Mr. Pandiri talked about it, others talked about it, that we have no business to only remain limited to those 602 districts or wherever we are. We have to reach out to every child, because 1098 has become a very powerful tool. It has been a very powerful tool since the beginning. In fact, on account of my police background, there was a kind of conflict of interest because I thought that maybe 100 or the police call, the police helpline is very important. But I found that the helpline run by us, 1098, has been far more powerful, far more potent, because right from the beginning, if you recall, the Childline has been run by the children who have been rescued from the streets. In fact, we took pride in the fact that the street children, working children who were rescued, they ran the child line. So it is something very, very important. And today it can be found everywhere, whether it is child welfare committee or it's juvenile justice system, it's rescue, it's a helpline, it is trafficking. Everywhere child line can be seen. 109, it is very important. One small point I want to make here, Mr. Panderi, I supported you, I strongly support you and child line in letting child line continue with Ministry of Women and Child Development. Well, I belong to police fraternity for 34 years and I'm nearly 20 years in child line. I feel that the right place for the child line happens with this gathering. The gathering I am here because the Women in Child Development talks about child in all its dimensions, all types, from rescue, development, rehabilitation, welfare, reintegration. All that stuff can be done only by this Ministry, Women and Child Development. So I'm not really in favor of child line being transferred to Home Ministry, but other things we'll debate later. Now, friends, since we are on the job, I think Rita, you can say what you want to feel like. Rita, unmute yourself. Unmute yourself, Rita. Yes.
Now I can. Now you can hear me?
Yes. Please carry on.
Okay. Namaste and thank you everybody. And Mr. Amod, it's been after such a long time seeing you, so good we can at least meet virtually. So as we celebrate 25 years of Childline service in support to the most vulnerable children of our country, it is also an appropriate time for us to look ahead at the future thrust of Childline. Childline should continue to be an emergency helpline services for children in crisis. That is a fundamental reason for its existence. Over the years, we have supported lakhs of children and rescued them from exploitation, abuse, violence, reconnecting and restoring lost, missing, trafficked children to their families. I believe that this experience and learnings should guide our way forward. The way forward, as I see, is in retooling some of the existing work. I have the following suggestions. 1, the knowledge center of Childline need to be strengthened and become a robust knowledge hub. And I purposely use the word hub. It has to be a hub. The knowledge hub must have a team of researchers, and they could invite research scholars to intern with the hub. It must be operational nationally and regionally. The Childline partners across the regions that have the capacity could be the regional knowledge hubs. This would add value to the creation of robust knowledge, as the implementing Childline organizations have the deeper insights of the problem. They have hands-on experiences, as well as they have the primary data with them. As a knowledge hub, Childline has empirical data, both quantitative and qualitative, which is collated over the years to inform policymakers, researchers, practitioners the crisis children are in. Along with hands-on work as an emergency service, we should do quantitative and qualitative research to understand the various factors and nuances of the vulnerabilities of the children, the child protection issues in the country. Childline should bring out research studies reports that could inform the ministries of WCD, law, education, Panchayati Raj, urban development, information technology, and Niti Aayog of the areas that need focus, budgets, policy, and program shifts. This valuable data would tell us what creates crisis in children's life, and also for identifying and zeroing in on districts where child protection systems are weak and from where maximum numbers of children are in crisis situation. The vulnerability mapping done some years ago was the beginning of this exercise, but it has to go further to feed the state and district administration with the data to take action. This would support the district administration to focus on these areas and implement the existing welfare and development programs, and most importantly, strengthen the effective implementation of child protection systems. It would result in informed policy formulations, programs for children in crisis, develop effective and practical strategies and action plans for addressing child protection issues. The endeavor is to witness a decrease in numbers of children in crisis and in exploitative situations.
Thank
In
you.
fact,
Thank you. Thank
I
you.
see Childline should lead the advocacy efforts for child protection. Second, a resource pool of trainers from across the Childline partners who could conduct trainings for various stakeholders. We need to institutionalize it so as to be part of the external resource persons of key training institutes. This initiative can go beyond India to our South Asian countries. We could tie up with SIVAC to organize training programs, have practice exchange to share knowledge and practices. This is something we should explore seriously. The South Asian region has helplines operating, and therefore this is a logical step forward. Thirdly, an annual, or once in 2 years at least, a conference to share and discuss the emerging trends on child protection issues. This could also be done in partnership with SIVAC as a South Asian conference. And lastly, Childline can also contribute in developing a course on emergency helpline services as part of social work academic studies. This would build a cadre of people. I mean, they would support in creating a cadre of professionals with theoretical knowledge and skills. Over the years, one has observed that it is of importance to have professionally qualified personnel to manage the emergency helpline. The Childline team addresses and supports children who are in grave crisis and therefore need staff who can give therapeutic care, write analytical report, collate and manage relevant data. I see this as the way forward for Childline. There is much more I could speak, but that time being the constraint, I would like to stop here.
Thank you
so much.
Thank you, Rita. All of us would fully endorse you. And brilliant points, Mr. Pandiri will make note of it. And then, of course, no other organization has such a huge data bank, huge information system as Childline has. And Childline has proved itself. These points are very well taken. Dennis, Mr. Dennis Rodriguez, please. Kindly unmute yourself.
Thank you, sir. Firstly, congratulations to the entire family of Childline. I'm privileged to be part of this panel discussing the way forward for Childline. When I joined Childline in 2001, I remember Charu mentioning that if we wanted to reach out to more children, we needed to ensure we had the latest, most up-to-date technology for children to access the number, for us to respond quicker to their calls, for us to document the calls for better follow-up, and to highlight gaps in service delivery. I'm proud that Childline has been a pioneering organization to leverage technology through the past 25 years. And I believe the way ahead is for Childline to continue to strengthen, consolidate, and use technology to ensure Childline remains a responsive service to the community. We have seen the telecom revolution. This has brought a change.
You're getting lost. Dennis, we can't hear you.
Hello, am I audible? Am I audible?
Yes, now, yeah. Please carry on.
Hello.
Could we proceed further? If Dennis, we are not able to hear you. Chinmay, I think we can go to you. Chinmay, Ajimji Premji has done the best thing to support Childline. Let me tell you. No other body can qualify as better than Childline to be supported. So you are there. Please come out with the experience. Chinmay.
Yeah, thank you, Mr. Amu. Am I audible?
Yes, very much.
Yeah. First of all, yeah, thank you, everyone. Thank you, Dr. Anjay and the Childline team for inviting me to be a part of this esteemed panel of, in a way, very eminent and experienced development practitioners working with children, child protection. I think, as Mr. Amod said, we at Azim Premji Foundation are a very young organization, still learning from all the experience that we are bringing from your work on the ground, as we stay committed to the cause of the most vulnerable people and children. So first of all, I again congratulate the Childline team for their efforts in reaching out to the children across such a large country like India with such diverse and rich socio-cultural and demographic context. I'll not take much time to share my ideas on the way forward for Childline. Most of the ideas have been shared by the other guests and the members who have joined today. But a couple of areas where we see a lot of opportunities with Childline. One is with the large network of over 1,000 NGOs, partners of Childline, reaching out to children from over 600 districts. There are a lot of opportunities to intensify the efforts in certain geographical, you can say, pockets, which are considered as source in terms of, or source areas in terms of high incidences of issues around children, be it child labor, child trafficking, child sexual abuse, child marriage, and how we can intensify the prevention effort through collaboration among the Childline partners and other NGOs and the child protection system at the local level. And obviously, I think people have mentioned that involving the community structures and strengthening the community structures on the ground, including involving youth. Similarly, in destination areas as well, there's a strong linkage which we see in certain destination areas where children come from source areas for different reasons. I think many of the Childliners have mentioned the reasons why children come to a destination area. So how can we map those source and destination patterns and then see how to improve restoration and rehabilitation effort, follow-up efforts? And all of us know how rich the data that Childline has and how that can allow us to do that. So again, concerted efforts there, and then trying to see how the resourcing at the source or destination can be done in accordance to the need and the vulnerability on the ground. I'm sure the Childline team is already thinking about it and building integrated efforts with the existing network on the ground. And there's a lot of potential to strengthen that effort. So again, thank you so much for allowing me to talk and share some ideas. But again, I would say that Childline with their reach has already been significantly impacting the lives of the vulnerable children. Wish you all the best. Thank you.
Thank you, Chinmay. You have correctly pointed out, and let me place on record that looking from the very beginning when we started, whatever Childline has done is far, far more than what we expected of Childline to do. We thought Childline is going to be a telephone call away, something happening there. But today we find that Childline is all over, and credit goes to all of you. So the gaps, of course, we'll talk about subsequently. But then there are still a lot of things to be done, and we can go ahead. This particular session is meant for that. Let's hear Nishit Kumar. Nishit.
Thank you very much. Thank you, Dr. Anjay and the Childline team for inviting me and asking me here to join this session. I don't feel like saying it's good to come back, because in my mind and heart, I never went away. And Childline still feels very, very close to me. When I look at the future, there are two critical trends which are very important. One is that the large-scale shift of population from rural to urban areas is going to intensify over the next 10 to 15 years. That's going to be a very marked change. So urban cities are going to be bigger, larger in terms of geographical size. They might be 80, 100 kilometers, from end to end. So that's one big change. The second is technology. Remember that even now in 2022, there is already a post-Gen Z generation of children. In 2014, in a school session, I remember a child got up and asked us, what is DIAL? They didn't know what DIAL was, because those days we used to write dial 1098. And promptly after that, we changed it to call 1098, because children had no clue what dialing was. So technology is going to change. So here's my quick assessment of what kind of technology you would need to enhance your reach, reduce your cost, and create ease of access. Remember that about 400 million children below 18, about 40% of them, around 16 to 20 million, are acutely marginalized. So I always used to say when I was there, I used to ask the question, how many calls, how many interventions are adequate, should we say, that are necessary? So, you should always keep that in mind. There are 16 to 20 million children of the total 400 million children below 18 in each year, of the decade, who are acutely marginalized. So that gives you a base to say how much more you should reach. How can you reach more? So one of the things is that from all social media, WhatsApp, Telegram, Signal, text messaging, you have to be able to make 1098 messageable. This is very, very critical because the next generation children are going to be using mobile telephoning much more. Then you have to have clickable links from to 1098 from Facebook, from Twitter, from Instagram, LinkedIn, and so on. So there should be a link button there. If you click it, you should be able to connect audio to the Childline Contact Center. That's critical. Then app-based connectivity. Or when I search for app, on App Store, I find that there is a Childline app from Trinidad. But India is the biggest child helpline service in the world. So you should have an app, a simple app, which children can access, which people can access, and they can snap a picture in a situation and send that directly by app. At all public places, you need standalone kiosks with touch screens and face recognition software built into those kiosks. And they should be hot linked to your Childline Contact Center. This is critical to enlarge your reach, reduce your cost of reach, and actually facilitate ease of access. The back end of CCC, somebody's already mentioned Aadhaar UI, the railway person said, but I think you need to back end connect the data of Childline to the Aadhaar data. So you must have connectivity which allows you in your tracing function much more easily. Online cloud-mounted e-learning programs, I already noticed you mentioned that, Dr. Anjay, that you're already doing that. It's wonderful, but you need to do that to train all your 10,000, 11,000 or 15,000 team members across the country, not just in the Childline Contact Center. Lastly, in technology, Childline is far too large now to be managed on documentation alone. ERP software, enterprise-wide system, which allows real-time data analysis is the need of the hour for Childline, and real-time data, is possible. It's connectable, from a front end on a mobile app is possible. Finally, some issues related to the organization structure, which improves the performance in a changing world, how the world changes, and in that, how will you? You have one collab model with one budget, and you give that budget to an organization that does 300 cases a month and an organization that does 5 cases a month. This one size fit all model will not make sense. You need to be able to shift to a model where you have a metro partners, you have urban partners, for tier 1, tier 2, tier 3 cities, and then you have rural partners who are based in talukas, not in district headquarters. We've been in our organization, we've been dealing with Childline partners in many districts, and we know that there is a gap between the district headquartered Childline and the taluka, the issues which are available in taluka. So that's the thing. For the contact center, you will need to have separate desks for disasters, for trafficking, for sexual abuse, for stress and anxiety counseling. So you will need to have specialized desks in your contact centers to do that. On the top of that, if you have rural partners in talukas, you may need to create a new preventive model so that they can continuously work on preventive models for this.
Thank you, Nishit. Thank you. Thanks a lot. See, you made the points which ranges from technology enhancement to the rural situations. These are the gaps, and these gaps, I am sure Mr. Pandey is taking down the notes from whatever we are saying. Yep. They're very, very important points. And I think the gaps, of course, they're critical stakeholders, starting from panchayats and villages, from where majority of children emerge. These 35 million odd children, CNCP children, child labor, homeless children, most of them really emerge from the villages. So our partnership has to go down to the villages also, and you mentioned about it. And technology, of course, is very important. I must compliment CIF for having kept abreast to the technology of the changing times. We started from nowhere, and today, of course, technology-wise, we are much better off. Mr. Pandey, I think your words, the final words, would be carrying a lot of weight. Please unmute yourself, Pandey. Yes.
Thank you, sir. Thank you, Rita. Thank you, Chinmay. Thank you, Nishit. Thank you, Dennis. I think very important. The critical recommendations have come in from this panel. Certainly, I will. I've taken note of these things. Very, very relevant. Rita made very relevant. Nishit, of course, made very, very relevant. Chinmay also brought out other angles. So I think, sir, I don't want to take much time, but I say from earlier speakers, this panel, the earlier panels, whatever recommendations, whatever suggestions are coming, we have moved a 25 years journey. We made a 25 year journey. We have very good achievements to celebrate. At the same time, we have limitations. We have challenges on the ground. So we have a terrible situations we come across, and we always, every time we are tested for times, things like that. So all these things we take in a very, very positive sense. And certainly because Nishit, when Nishit is with us, we tried some of these things, and still we are going to do that. And Nishit, whatever recommendations, whatever thoughts you used to have that items, some we are able to implement, some we are not able to implement because of many reasons. So I think one is critical point is that we are going to focus in future more on research, evidence-based research that will be kind of a more useful for our evidence-based research and advocacy. So that is one we are going to take it. Though the data is very sensitive, that last 9 months how we are facing a lot of challenges on the ground, at our CF level. That is one. But however, we are just trying to find out a very good, meaningful way of doing things. That is one. The second thing is definitely technology. Technology is going to be a very, very important factor. And we're trying to integrate wherever it is possible based on the kind of technology available and also resource available. We moved, I don't say that great we moved a great way, but certainly we moved we achieved quite a bit on that front. Whether it's a LMS, whether it's a kind of, the case management, mobile app for case management, things like that. We are moving in that direction. And also we are now entirely moving in the grant management system online, a completely digitalized version. So I think that is one. Then we are also focusing, we developed a kind of 5-year strategy paper, which is not rolled out or which is not present in the public domain. But however, that also gives us a kind of outcome focus. And we also focusing on the capacity building. We also trying to bring in excellence in our work, in our operations, in our functioning, in our entire system, and also the cost effectiveness. And also we are looking at the greatness lies in not only the quality of service the children, but also the reputation that we maintain all through, the transparency, the accountability that we have been maintaining since its inception. And thank you for everyone, every generation of this leadership, every generation of these teams. Everybody tries to maintain that reputation, that accountability, that transparency, the core values that we maintain. So we continue to maintain that core values and we build on further than that. So these are some of the points I would like to say. And with this, we are noting down all these things. One thing we are saying that now, since this online has given a way to interacting with the people, I think this we never learned it, but we have, because of pandemic, we are able to do more on kind of online. And Rita, we are also going to meet in person, face-to-face meetings. We are going to have it in future, also online. I think this tradition, we'll revive this because of some reasons or other reasons, we are unable to move forward. But I think we can go ahead with that kind of futuristic vision. I think certainly, I don't know how many of you there, but this Childline India Foundation is going to celebrate even the Golden Jubilee also. I can assure you that I dream and I will be probably, I wish, I desire that, because 25 years we celebrated and we are going to celebrate another, 25 years, which is a Golden Jubilee. So that everybody needs we need blessings from Ahmad Khan sir and, Dr. Venkatrao is there, my teacher, my, my mentor, my primarily who is the person, who made me to, come into this profession, So I think, thank you so much, Chinmay, for Nishit. So it's great to connect back and all, the same frame, all. So thank you so much. And thank you so much for everyone. Thank you very much.
Thanks to all of you. And 11,000 of us, 11,000 co-workers in the Childline today. Let me inform you that even Niti Aayog recognized that all of them are frontline workers. We lost many of them. And thanks to Punita Buddhiraja, who brought out such a poignant presentation about them. And thanks to all of you. Let's conclude. Thank you.
Thank you.
Thank you so much. Thank you so much, Ahmad Khan sir, and thank you, Rita ma'am. Thank you, Nishit, for being with us. For Chinmay, thank you. Dennis, thank you. And Dr. Anjaya, thank you a lot. And with this, we are moving to the next. And there is a poll waiting for you. Please join the same website and join the poll.
Please refresh your windows. We've made note of all your suggestions from the past session. We'd also like to find out others, what is your dream for Childline for the next 25 years? So if you can just post your responses, we'll have a solid set of areas that we can look to build on. The link to the survey is also in the chat box. Else you can go to menti.com and use the code 5597 9338.
We are eagerly waiting for your responses. Please reply on poll.
Thank you, everyone. I'll keep the poll open. I'm just going to stop the screen share so you can continue to enter your responses.
Thank you, Ganga. And we are waiting for your responses. Truly, all your inputs would be very valuable for us. And we are moving to our next session, and we want to know the premises of positive work in our society. To know more onto this, we are delighted to have our next speaker, Dr. Venkat Rao Pulla, MA, TIS, PhD, Karnataka University, Dharwad, Foundation Professor of Strength-Based Social Work Practice, Brisbane Institute of Strength-Based Practice, Australia. So we want to hear from you, sir. Over to you.
Thank you very much. I think I'm unmuted.
Yes, yes.
Yes, I just
Very
needed
audible.
to make sure that is my screen share.
Not yet, sir.
Right. Is the screen being
Yes.
shared now? Excellent.
Yes, sir. Yeah.
Okay, for the last 2.5 hours or so, it's almost about 11:30 now, but for the last 2.5 to 3 hours that I've been listening to, only because one, I had my program at 11 o'clock for the next 10 minutes. Then at the same time, I also wanted to know what is actually happening in this particular world. And I'm extremely, extremely honored, impressed to hear the progress of this particular child line and the way it has been functioning. I've known the TISS colleagues. I've known Rita Panikar, who was my senior in the Tata Institute of Social Sciences, and I've met her for the first time on this Zoom at this point of time. You know, you can always forgive a few things, but you can always show your gratitude to the pandemic that the Zoom has actually brought in a whole lot of us together. In terms of my presentation, which is very, very short, the premises of positive work in our society, I think I wanted to mention this to you, that when I always talk about the forms of social work that influence our society, a lot of them come to me from solution-focused, positive social work, strength-based practices. But the work you do in that space for children, the innocent, has been praiseworthy. Many things have gone wrong with them, not necessarily because of their own mess, but because of many defects in the adult systems itself. And to a large extent, even our own systems as it is. That for the last 25 years that your motivations have assisted constantly to keep up their aspirations, their hopes, and also to work with their dreams, I think stands out very, very clearly. One of the good things that I find in the last 3.5 hours or so that I've been listening to, first half an hour I lost it because we have a flood situation even in Brisbane, and for a little while I lost my connectivity. This is the only ideology that you have is the child's concern. No leftism, no rightism, no mid-paths, no nothing. Oh, thank God for small mercies, otherwise we would have been really, really divided as to what is it that we need to work around. And of course, at the same time, as I said, there are no other colors too. 25 years is a big time. I became a lecturer by then, but for an organization that has expanded today, and I see the enthusiasm of the founders, I see the enthusiasm of people who worked from it, with it, from home ministry, those people who are connected with this, who are talking about CRM, talking about various other kinds of things that we could basically be utilizing from back end, utilizing the technology. Those who are talking about social media obviously are talking about the agenda for the next 25 years. A long way to go, but probably in the next 5 years itself, a lot of policy work. And the critical element in all this policy work of yours is just to recognize that the child has those rights and then you need to work with those. Certainly, you've questioned the system. Rita Panekar and all these social workers have questioned the system. Many of you have questioned the system. But at the same time, you've also offered suggestions. But you also decided to subversively work with what is existing. That's the beauty of it. You have utilized, you have trained police, you have trained home ministry, you've trained child welfare ministry and everybody else for that matter. Whether police need further training, whether child welfare needs further training is a matter of detail, but you would always go there. This milestone of yours ought to reiterate the child's problem is elsewhere. The child himself isn't the problem. You have a new agenda to sensitize the whole society. Whether you do it just because there are these corporate social responsibility dollars everywhere, or you do it because automatically this is to be done throughout the society, is something that you could do. The premises of positive social work recognize that people ought to be credited with a level of expertise to solve their own problem.
Gratefully, this NCPC chairperson.
Beg your pardon? Okay. All right. The premises of positive social work recognizes that people ought to be credited with a level of expertise to solve their own. And as 1,100 organizations today, with so many 11,000 workers, or probably more than that, you have been seeing behind not just working with the children, but there are NGOs which are also working around that people have strengths, people have capacities, people obviously can change, and people change as a result of understanding who is supporting them, who is looking after them, and who is recognizing what their strength is at that point of time. Apply what I'm saying to children, apply what I'm saying to organizations, apply what I'm saying to the systems itself. When we know what is best, when we know what the problem is, we also probably definitely know what the solution is. So it's a question of how do we manage to take it upward? How do we manage to sell this? How do we market this towards from where we require the solutions. That becomes very, very important. Over a period of time, I did see a lot of people who have power. They set the agenda, they control the agenda, they know how to deal with it. But I suppose the child line in a way grew from those very basics of what the child needed. When they've said there was a small army of children who knew what needs to be taken care of, whether they were street children or whether they were rural children. They knew what was required. They suggested to you what is needed. I think that's a great learning for us so that we don't set an agenda. Yes, we make it up. We make up a few things. We make things in terms of the systems that are required for us. I think it was an excellent idea to use all the social media, to use all the technological advancement that we do have. And of course, children are getting around that. Any other approaches which basically create passive dependence, blaming people, blaming children for what they are in, and acting ourselves as, completely controlling, probably are the kind of things that we should be trying to avoid. I guess any approaches where coercion is there, anything if we don't listen to the young children, anything that we don't listen to the organizations themselves at the grassroots. Some people, I just happened to see very quickly some of the suggestions that were coming around. Someone who works for a few years looks forward for a promotion. Someone looks forward for something else. Taking care of our own people is very, very important. Just as in pandemic, you managed to get Niti Aayog has recognized all these workers are essential workers. It also means they require essential care. The brotherhood amongst our own self, taking care of them. A celebration of 25 years need to be passed on to each and every one, and trying to ensure what is right with them and enjoying that right activity. One of the things, of course, has always been going on, including social workers who come out from professional schools. We blame, label, classify, exclude, give unsolicited advice, which is, of course, very, very true. It's cultural for Indians to do that, for our society to do that. We've always done that, telling people what their strengths are, and also trying to tell them their views, plans, and we give them strategies as quickly as possible. Whether it is a child, an organization, a group of people, volunteers, when will they change? When will empowerment come around? It comes around when people feel safe, when I feel my voice is being heard, when I feel I'm being valued, when I feel internally I'm confident that I am making some sense. Feeling heard and validated is an important issue for the child. Push him away, he goes away. Because that's the kind of thing. Innocence is the blossoming time. That's an opportunity. Of course, you know it. Others know it. And the same thing needs to be applied. The span, when we talk about lifespan, there is a lifespan for an organization. There's a lifespan for a volunteer. A sense of hope for the future. Where to from here for the volunteer? How long is long? Is it a furlong? Is it a mile? How long? Sufficient motivation and certainly sufficient resources. Resources will come by. If you have a dream, you have a technology, you have an idea, then automatically you will fill in. First, it's of course, the question is of idea. I'm so grateful I could hear in the last 3 hours or so such voices, such creative militancy, such positive militancy in the whole voice. Militancy is generally a negative word, but here is one place where we could use. So what are we doing? We respect the uniqueness within our own country, use respectful communication, collaborate, consult, mutually learn, and keep up, as somebody has really said, open transparency throughout what we are trying to do, and agree to do a few things. Because when we download an agenda, whether it's on Anjaya or whether it's on these 25 other people who are working, or 2,500 workers throughout the country, please understand any new agenda needs to be resourced too. Anyone who gives a technological solution, good on you. How do I go about doing it? So you need to give me not just technology, but also the wherewithal with that particular thing. So whenever we talk about these vision exercises, which is what Gangama was trying to do through your research, a vision of what things would like to be, exploring some values, future possibilities, some aspirations, some hopes and some dreams. And how do you go about doing that? Sit again. We all know about the strategic planning. We all know we are very good at that. But essentially, in all of that, is child who matters? Is he being consulted? And how much of consultation at that grassroots is something that is actually happening? So I'm just coming to my last slide. An approach that I wanted to talk about, the premises of any positive work would be an approach to people which is primarily dependent upon your positive attitude. Don't worry about what's happening elsewhere, whether it's Ukraine or Uttar Pradesh politics or anything else. It's of no consequence. The child in any of these areas is of great consequence. A child who is a refugee, a child who is possibly held up in a disaster. A child is a child, and you are reaching him. So therefore, when we reach, our concern is, and we are lucky in this, that it just, the child concerns cut across all intersectionalities, and child concerns cut across all those ideologies. You know, I'm kind of tired every time looking at the ideological polarizations that always take place. One of the good things, luckily for me, is I keep coming to India too often, so there's an opportunity for, and also the privilege, and of course I use that with reticence, that privilege I use it with reticence because I live here and I live there too. But certainly an ability to comment on what happens. One of the things that we need to happen is creativity, compassion, and these two things need to be brought together. A compassionate orientation with which we emphasize the ability, or as a change agent, to change things and to create conditions that will also enable people to control their own actions for the future. I congratulate all of you. I'm grateful for this opportunity and grateful to all of you for your wonderful ideas. Thank you very much.
Thank you so much, sir. It was so nice presentation. Thank you so much once again. And now it is time to know on synergy with allied system for child protection. And we would request Dr. P.M. Nair, former Director General, National Disaster Response Force, to share a few words on this. So, sir, requesting to join Dr. P.M. Nair, sir. Yeah, over to you, sir.
Thank you. Namaste. Good evening to all of you. Can you hear me?
Yes, sir, clearly.
Yeah, I might stay outside. That's why I asked this question. Well, thanks a lot for this invitation and program. It's commendable work. Hearty congratulations to Childline for having completed successful, wonderful years. Amazing work done by a dedicated team of experienced, truthful work, diligent work. And despite COVID, when all were safe at home, Childline made it safe for those who were not safe at home. Those who did not have a home had a home called Childline. I really appreciate it. I have physically seen that across India. Congratulations to Dr. Anjaya Pandridi and his vibrant, wonderful, committed, and most vibrant team. I salute all of you. I salute all of you. The whole nation salute you. And I join the nation in this process. The topic given to me is on linkages. Let me start with 4 examples. Number 1, during the lockdown, when the whole country was locked down, and we thought we are all safe at home, the railway child line in the central part of India, in Hyderabad, Secunderabad area, in 5 railway stations, they rescued 444 children. 444 children rescued in a matter of few months in the heartland of India. during the COVID time, when we were locked down in our own homes, when we thought every child is safe at home. Who are these children? How did they come there? And mind you, these children, more than 50%, 60% of the children are from different parts of the country. They are from Manipur, they are from Assam, they are from Mizoram, they are from West Bengal, they are from Odisha, they are from Jharkhand, they are from Jaipur, they are from Rajasthan. How did they come there? Children don't come there. No child runs away. Children are made to run away. Children are made to run away. These children have been trafficked. These children have been escorted. These children have been hired. You know, there is a person behind these children coming up. We in the childline language, you call them as agents. Fair enough, because childline is not a police agency to accuse them or to brand them as offenders. But having been a police officer for 35 years, I know it's nothing else but trafficking. Ladies and gentlemen, these children who are made to run away are not running away. All these children have been trafficked. Who are these traffickers? They are masterminds. You know, they have solid linkage from source to transit to destination. Source to transit to destination is a very well-organized, well-oiled network making tons of money, whereas we don't know what's happening. Many of us are not even aware of what's happening. Number two, let me take the case of a case from Tirchur railway station in Kerala, where the trafficking hub, their children are brought there for being transported to this side and that side of Tamil Nadu and other places. Yeah, I have seen a hub in Katihar in Bihar. Katihar is another hub in Bihar where transportation takes place. Siliguri in West Bengal. I can give on list of a lot many hubs. What are these hubs? What does it mean? A trafficking hub where Childline rescues a lot of children going this way and that way and this way and that way, railways or bus stands or districts, wherever they are. Third example I want to give is about the Child Welfare Committee of Jaipur, where I happened to visit during the COVID time. The vibrant Child Welfare Committee chairperson was telling me, sir, I have rescued I have seen the same child appear thrice over 2 months' time before me. 3 times in a matter of 2 months, the same child appeared before the Child Welfare Committee. And all the 3 times, the child have been rescued by some NGO, not Childline, some other NGO. What does it mean? Children are being rescued and so-called rehabilitation. They are sent home somewhere, and trafficker brings the child back. You know, this is astonishing. Our children are being rotated like cattle. I'm sorry to say this is unfortunately happening there. You know, the child is rescued 3 times over. You know, our heads could hang in shame that we are not able to rehabilitate the child properly. Ladies and gentlemen, there is a missing link in response. Very serious missing link in the response. The agencies are working in silos. There are very good agencies. Childline is an amazing agency doing commendable work. But my question is, are they getting enough support from the other agencies concerned? Childline can rescue. Childline can counsel. Childline can produce a child before the Child Welfare Committee. Childline can advise the Child Welfare Committee. Childline can advise the police. But the law enforcement agencies to act. The central agencies to act. The state police agencies to act. Now, is that happening or not? You know, the question doesn't need an answer. It's obvious. Now, ownership is missing. How many of us have that ownership? The ownership Childline people have. I've seen Childline in Ranchi at 12 o'clock night. They happened to go there for some work. I said, let me walk into the railway station because I started my IPS career in Ranchi way back in 78. I went there recently and found Childline working. Entire railway station is sleeping. Nobody is there. Trains are not coming there. But the Childline is working there. And they had rescued 2 children and they're talking to them. I was amazed the commendable work the Childline is doing. Now, the point is, they can rescue, they can talk to the child. After that, what? Since I happen to know the police officers, I called the SSP at late night, 12:30 night, and told the SSP, send a car. The child rescued has to go to a place called Manda, which is around 2 hours from here. Please send the child tonight itself. And since I was there, I could do that. But when the Childline calls, will the police respond or not? There is a need for ownership. Ladies and gentlemen, let this mission go on from today, that from the Childline, whatever experience you have, let that same ownership be taken by all agencies concerned. Resources are scant, but scattered and not reaching the right place. Childline is a scant of resource. I'm well aware of the Childline agencies and volunteers working.
Thank you.
Volunteers working. How long can any volunteer work without adequate remuneration? It's time the government take initiative to increase the remuneration to these people who are voluntarily working. It's an amazing work. Even I don't want to criticize the government because I'm part of the government. I respect government and I'm with the government. Therefore, my humble request to the powers that are is to ensure that the Childline gets adequate, Childline volunteers get adequate remuneration so that they can stand on their own, they can take the mission forward. Now, lesson is in synergy. It is less talk and more work.
Sir, for
That's
the
not enough.
time.
We need to walk the talk and work the talk. We need to walk the talk and work the talk. Well, what is to be done? I'll conclude in 2 minutes. I know Madam is showing her fingers. Yes, ma'am. I'll do it. 2 points, 3 points from my side. Childline and district police should work together. We have anti-human trafficking units, AHCU, in all the districts in the country. I was privileged to set up the first 9 AHCUs in 2007 when I was working with the MHA and the UN ODC. Now, all of them have been replicated to 629 districts in the country. All the districts, AHCUs should work along with the Childline. Wherever I go for training, I tell them, first and foremost, are you working with Childline or not? If not, start the work today itself. So you must go along with the AHCU. Number 2, Panchayat against human trafficking. We have set up something recently called Panchayat against human trafficking. You know, the source area is very important. When you rescue a child goes to the village, please link up with the Panchayat president. 90% of them are very good people. Link up with the Panchayat president, Panchayat member, Panchayat secretary, tell them, boss, your child is being trafficked or being exploited, being taken away, being violated, being exploited. They will understand. So I would request Childline to work along with Panchayats. Wherever required, Panchayats can be linked up. I'll be too happy to link you up with that part. Third point is about anti-human trafficking club in the colleges. Very interesting system we have started in many colleges. The youth has tremendous power and potential. That power of the youth is channelized into anti-human trafficking clubs in the colleges. We have SOP for AHTC. We have SOP for Panchayat against human trafficking. Take the SOP and utilize them. So join the Panchayat anti-human trafficking clubs in the colleges and Childline can work along with them. Ladies and gentlemen, no child is for sale. No child is for exploitation. Our children are not cattle. Our children are not for exploitation. Our child has to have a life of dignity and freedom. Childline will ensure that we will work along with the Childline, police, anti-human trafficking unit, plus the Panchayat against human trafficking, plus the anti-human trafficking cell of the colleges. We can work together, take the mission forward so that our children are safe. Our children are living in a life of dignity and freedom. Spot it, speak it, act it, and stop it. Spot it, speak it, act it, and stop it. Thank you. Namaste. Jai Hind.
Thank you. Thank you so much, sir. Thank you. Very nice. It was. And with this, we are moving just because time. I'm poking everyone. I'm very sorry for that. But we feel honored to announce that we welcome now Mr. Priyank Kanungo, Honorable Chairperson, National Commission for Protection of Child Rights, Government of India. And sir, it is really motivating to have you in this session, to hear from you. We are waiting. And my humble request you to share your kind words, sir. Sir, over to you.
नमस्कार। आदरणीय नायर साहब नमस्ते। और यहाँ डॉक्टर अंजैया, बाकी सभी चाइल्डलाइन के वॉलंटियर्स, पार्टनर्स, मैं आप सभी को बहुत बहुत शुभकामनाएं देता हूं इस बात की। आज आप लोग अपना सिल्वर जुबली जो है वो मना रहे हैं। चाइल्डलाइन का एक सफर शुरू हुए आज एक ऐसे मुकाम पर, ऐसे पड़ाव पर है जहां हम ये संतुष्टि महसूस कर सकते हैं कि पिछले 2.5 दशक में, 25 वर्षों में आप सबने मिलकर जो कुछ किया वो डेफिनेटली देश के लिए, समाज के लिए, बच्चों के लिए एक राहत देने वाला काम तो था ही था। मैं ये समझ सकता हूं और महसूस कर सकता हूं कि आपके मन को कितना संतुष्टि देने वाला काम आप लोगों ने किया। मैं इस बात में बहुत फर्मली बिलीव करता हूं कि एक ऐसा काम है जो किसी ने इसलिए कैरियर की तरह नहीं चुना कि उनको बहुत ग्रोथ मिलेगी, किसी ने इसलिए कैरियर की तरह नहीं चुना कि वो मॉनेटरी बेनिफिट्स के लिए जाना चाहते हो, बल्कि मैं तो ये कहूंगा कि किसी भी चाइल्ड लाइन वॉलंटियर ने ये काम खुद चुना ही नहीं। ये निर्णय भगवान का होता है कि किन से वो ये काम कराना चाहते हैं। ये निश्चित रूप से एक बहुत ही पवित्र काम, बहुत ही पाक काम है जो करने के लिए उन्होंने आप लोगों को चुना। निश्चित रूप से मैं उन चंद भाग्यशाली लोगों के साथ आज मुखातिब हूं जो भगवान द्वारा चुने गए एक बेहद महत्वपूर्ण और पवित्र काम के लिए, उन बच्चों की मदद के लिए जिन बच्चों को वाकई इमीडिएटली मदद की जरूरत है। जीवन को आकार देने का काम, जीवन देने का काम माँ का, भगवान का, जीवन को गढ़ने का काम शिक्षक का, लेकिन इस सब से किसी भी मायने में एक चाइल्ड लाइन वॉलंटियर का काम कम नहीं है। जीवन को बचाने वाला, जीवन की दिशा बदलने वाला जो काम चाइल्ड लाइन के वॉलंटियर्स देश भर में कर रहे हैं वो अनुकरणीय है, वो सराहनीय है, वो प्रशंसनीय है और वो देश भर की तरफ से आज आपको धन्यवाद करने योग्य काम है। मैं ये भी जानता हूं और महसूस करता हूं कि हम सभी लोग जो काम कर रहे हैं उसे थैंकलेस जॉब माना जाता है, कोई हमको कभी याद नहीं करता, लेकिन हमारे मन में जो संतोष होता है कि आज हमने एक बच्चे को, दो बच्चे को रेस्क्यू किया है, हमारे मन के सुकून के लिए हम वो काम कर रहे होते हैं, उससे बड़ा संतोष कोई नहीं होता। दुनिया हमको कभी इस काम के लिए रिकॉग्नाइज करे या नहीं करे, लेकिन हम जानते हैं कि हमने जो काम किया है उससे कम से कम एक बच्चे का जीवन बदलने का हमने काम किया है। मैं हमेशा ये बात महसूस करता हूं कि हमारा चाइल्ड लाइन का वॉलंटियर जो दिन में या रात में बच्चों को रेस्क्यू करने के काम में लगा होता है, उसको बहुत बड़ा कोई पीछे से बैकिंग या प्रोटेक्शन नहीं मिला होता। कई बार हमारे वॉलंटियर की जान खतरे में होती है। मैंने कमीशन में चेयरपर्सन रहते हुए या मेंबर रहते हुए ये हमेशा कोशिश की है कि मैं चाइल्ड लाइन के वॉलंटियर के पीछे बैकिंग सपोर्ट के रूप में एनसीपीसीआर को खड़ा रख पाऊं। और कायदे से एनसीपीसीआर का ये कर्तव्य है कि जब हमारा कोई चाइल्ड लाइन वॉलंटियर दिन में, रात में, किसी भी परिस्थिति में, चाहे वो कोविड का टाइम हो, चाहे वो किसी अर्थक्वेक का टाइम हो, कोई नेचुरल कैलेमिटी हो या कोविड जैसी महामारी का समय हो, जब खुद की जान को खतरे में डालकर बच्चों के संरक्षण के काम में लगा होता है, जब वो ट्रैफिकर से लड़ रहा होता है, जब वो हार्डकोर क्रिमिनल से दो हाथ ले रहा होता है, तब कम से कम उसकी बैकिंग के लिए एनसीपीसीआर खड़ा रहे, हमारे स्टेट कमीशंस खड़े रहे, लॉ इन्फोर्समेंट अथॉरिटीज को हम ये बाउंड कर सके कि चाइल्ड लाइन वॉलंटियर का काम जितना प्रीशियस है, उस वॉलंटियर का जीवन भी उतना ही प्रीशियस है और उसको सुरक्षा देना भी हम सबकी मिलीजुली जिम्मेदारी है। ये कर्तव्य हमारा मानकर हम लोग इस कर्तव्य का निर्वहन करने की कोशिश करते हैं। मैं ये समझ सकता हूं कि आप लोगों की तमाम परेशानियों और तमाम दिक्कतों के बीच में आप लोग जो इस काम में लगे हुए हैं वो निश्चित रूप से देश को आगे ले जाने वाला काम है। आप जिन बच्चों के जीवन को संरक्षित करते हैं वही उस देश को आगे बढ़ाने का काम करते हैं। और कायदे से तो आज के दिन जब हम इस पड़ाव पे हैं, हमको उन समस्याओं के बारे में बात करनी चाहिए थी जो चाइल्ड लाइन वॉलंटियर्स फेस करते हैं और उन समस्याओं का निदान हम सब मिलकर कैसे कर सकते हैं, इस तरफ हमको काम करना चाहिए था। खैर, किसी और दिन मैं आप सभी से गुजारिश करूंगा, जिस दिन भी चाइल्ड लाइन के वॉलंटियर, चाइल्ड लाइन के पार्टनर्स एनसीपीसीआर के साथ, एससीपीसीआर के साथ इन इश्यूज पर बैठकर बात करना चाहें तो आपके लिए सभी स्टेट कमीशंस के दरवाजे हमेशा खुले हुए हैं। आपको कभी भी किसी भी मदद की जरूरत है, आपको कभी भी किसी भी चीज की आवश्यकता है, आप लोग प्लीज feel free to call NCPCR or any SCPCR in the country. आप सभी ने आज मुझे बुलाया, अपने बीच बात करने का सम्मान दिया। मैं आप सभी का बहुत बहुत आभारी हूँ। धन्यवाद।
धन्यवाद सर। और सच में आज देश भर में हमारे पूरा चाइल्डलाइन प्रतिनिधि जो भी आपको सुन रहे हैं, उन सब के लिए आपका मैसेज बहुत ही महत्वपूर्ण है। और थैंक यू हमारे साथ जुड़ने मतलब रहने के लिए, और फॉर योर काइंड सपोर्ट, योर कोऑपरेशन, एंड थैंक यू फॉर दिस कोलैबोरेशन। हम और भी आगे आपको बहुत जरूरत होगा, एंड वी विल लुक फॉर दैट सर। थैंक यू सो मच।
थैंक यू।
थैंक यू। And with this, we are moving to the next session, and there is a very nice session for all of you. And this session, you know, all of us, we are talking so much, an excellent thematic session we have already got, but now it is time for remember your childhood, to keep alive your childish bachpana that you need to keep on. And that is why I would request my colleague Sohali Verma, Sohali, to come on, and all the panelists will join this session. They are Dr. Anshumali Sharma, Director HUM, Childline Director, Mr. Wasim Iqbal, Director AIMS for Awareness for Society, AAS, US, Mr. Debashish Rath, Executive Director, RUSH, Dr. Srilekha Roy, Executive Director, VHAT, Agartala Childline. So all the Childline directors along with Sohali, all the best, and we are looking for a very nice session from you. Please.
Thank you, Lena. Sabhi ko namaskar. Childline would like to conclude today's program with recitation of a famous Hindi poem titled as Mera Naya Bachpan. The poem is written by Srimati Subhadra Kumari Chauhan. The poem celebrates childhood. The poetess fondly recalls her childhood memories, reminiscent of the days filled with innocence, laughter, and joy. She yearns to relive those carefree days, but finds solace in the childhood journey of her daughter. समारोह के इस भाग में अब हम आपके समक्ष प्रस्तुत करेंगे हिंदी भाषा की सुप्रसिद्ध एवं मनमोहक कविता मेरा नया बचपन, जिसकी रचयिता हैं श्रीमती सुभद्रा कुमारी चौहान। इस कविता में कवयित्री अपने बचपन की मधुर स्मृतियों को याद कर रही हैं। वे कहती हैं कि बचपन का भोलापन, अटखेलियां, निश्चिंतता, निडरता और स्वच्छंदता अनमोल है। बचपन की यादें हम सबके मन में खुशी भर देती हैं। चिंताओं, जिम्मेदारियों और संघर्षों से भरे जीवन में हम अपना बचपन, वह खोई हुई खुशी, हमारी आने वाली पीढ़ी, हमारे बच्चों को एक सुरक्षित और संरक्षित बचपन देकर फिर जी सकते हैं। चाइल्डलाइन बच्चों की इन्हीं खुशियों को, इसी मुस्कान को बनाए रखने के लिए अथक प्रयास कर रही है। आइए हम सब मिलकर एक प्रण करें कि बच्चों के हितों और मूल अधिकारों की रक्षा के लिए सदा कार्यरत रहेंगे। अब मैं चाइल्डलाइन डायरेक्टर्स से अनुरोध करूंगी कि वे आप सबके समक्ष कविता प्रस्तुत करें। धन्यवाद।
बार बार आती है मुझको मधुर याद बचपन तेरी, गया ले गया तू जीवन की सबसे मस्त खुशी मेरी। चिंता रहित खेलना खाना, वह फिरना निर्भय स्वच्छंद, कैसे भूला जा सकता है बचपन का अतुलित आनंद। ऊंच नीच का ज्ञान नहीं था, छुआछूत किसने जानी, बनी हुई थी वहां झोपड़ी और चीथड़ों में रानी। किए दूध के कुल्ले मैंने चूस अंगूठा सुधा पिया, किलकारी के लोल मचाकर सूना घर आबाद किया। रोना और मचल जाना भी क्या आनंद दिखाते थे, बड़े बड़े मोती से आंसू जयमाला पहनाते थे। मैं रोई, माँ काम छोड़कर आई, मुझको उठा लिया, झाड़ पोंछ कर चूम चूम कर गीले गालों को सुखा लिया। दादा ने चंदा दिखलाया, नेत्र नीर युत दमक उठे, धुली हुई मुस्कान देखकर सबके चेहरे चमक उठे।
यह सुख का साम्राज्य छोड़कर मैं मतवाली बड़ी हुई, लुटी हुई कुछ ठगी हुई सी दौड़ द्वार पर खड़ी हुई। लाज भरी आंखें थी मेरी, मन में उमंग रंगोली थी, नाम रसीली थी, कानों में चंचल छेल छबीली थी, दिल में एक चुभन सी भी थी, यह दुनिया अलवेली थी, मन में एक पहेली थी, मैं सबके बीच अकेली थी, मिला खोजती थी जिसको है बचपन, ठगा दिया तूने और जवानी की फंदे में मुझको फंसा दिया तूने।
सब गलियां उसकी भी देखी, उसकी खुशियां न्यारी है, प्यारी प्रीतम की रंग रलियों की स्मृतियां भी प्यारी है। माना मैंने युवा काल का जीवन खूब निराला है, आकांक्षा पुरुषार्थ ज्ञान का उदय मोहने वाला है, किंतु यहाँ झंझट है, भारी युद्ध क्षेत्र संसार बना, चिंता के चक्कर में पड़कर जीवन भी है भार बना। आजा बचपन एक बार फिर दे दे अपने मन की निर्मल शांति, व्याकुल व्यथा मिटाने वाली वह अपनी प्राकृत विश्रांति, वह भोली सी मधुर सरलता, वो प्यारा जीवन निष्पाप, क्या आकर फिर मिटा सकेगा तू मेरे मन का संताप।
अनम्यूट।
माँ बचपन को बुला रही थी, बोल उठी टिया मेरी, नंदन बंसी फूल उठी ये छोटी सी कुटिया मेरी। माँ आओ कहकर बुला रही थी, रोटी खाकर आई थी, कुछ मुंह में कुछ लिए हाथ में मुझे खिलाने आई थी। पुलक रहे थे अंग, रगों में कौतूहल था छलक रहा, ऊपर भी आह्लाद लालिमा विजय गर्व था झलक रहा। मैंने पूछा ये क्या लाई, बोल उठी हो माँ काओ, हुआ प्रफुल्लित हृदय, खुशी से मैंने कहा तुम ही खाओ। पाया मैंने बचपन फिर से, बचपन बेटी बनाया, उसकी मंजुल मूर्ति देखकर मुझ में नवजीवन आया। मैं भी उसके साथ खाती हूँ, तुतलाती हूँ, मिलकर उसके साथ स्वयं मैं भी बच्ची बन जाती हूँ। जिसे खुशती थी वर्षों से अब आकर उसको पाया, भाग गया था मुझे छोड़कर वो बचपन फिर से आया, वो बचपन फिर से आया।
Very nice. Sohali, so you want to say anything here?
धन्यवाद सभी चाइल्ड लाइन डायरेक्टर्स का। और मैं केवल अपना प्रण और सभी को यही रिक्वेस्ट करूंगी कि आइए हम सब मिलकर प्रण करें कि बच्चों के मूल अधिकारों, उनके हितों की, उनकी खुशियों और उनकी मुस्कान को बनाए रखने के लिए हमेशा कार्यरत रहेंगे। धन्यवाद।
Thank you a lot, Sohali. Thank you all the directors. You are truly childline directors. और इतने nice presentation it was. We will remember always for next 25 years. सच में. And with this, our next poll, छोटा सा poll, and उसके बाद we will go for vote of thanks. So please be ready with the same link, with the same passcode, and enter your replies. Ganga, over to you.
Folks, you've been here before. The link is in the chat. Otherwise, you can go to www.menti.com and use the code 5597 9338. In 2 to 3 words, wish the Childline family into her journey for the next 25 years. I'm going to stop the screen share, but you can continue entering your responses. Thank you so much, everyone. We will be sharing the poll results with you post the meeting. So in case any of you still want to respond there, please feel free to.
Thank you, Ganga. And with this, we will at the end of the programs. So I would request Mr. Shushovan Shi, Head Interim Charge Regional Resource Center East, Childline India Foundation, for vote of thanks. Shushovan, over to you.
Thank you, Lena. Am I audible?
Yes.
Yeah. Gratitude is one of the least articulate emotions, especially when it is deep. Good evening, all the members of our Childline Special Family. We have reached the closing of this beautiful celebration of 25 years of Childline. But we see it as a beginning in many ways. On behalf of Childline India Foundation, I would like to extend my heartiest thanks and regards to the Honorable Minister, Ministry of Women and Child Development, Government of India, Secretary, Ministry of Women and Child Development, Government of India, Chairperson, Governing Board of CIF, Additional Secretary and Financial Advisor, Member of CIF Governing Board, Joint Secretary, Ma'am, Joint Secretary, Ministry of Women and Child Development, and Chairperson of CIF Managing Committee, the Department of Telecom and Ministry of Railways for their support and leadership to Childline. We thank the Honorable Chairperson, National Commission for Protection of Child Rights, Government of India, for your expert direction, sir. Dr. Professor Venkatapulla, we are grateful to you for your enlightening us all the way from Brisbane. We look forward to more interactions with you, sir. Mr. PM Nair, sir, you have been a source of strength and counsel to Childline for several years. Thank you for being with us. And we express our thanks to Dr. Shalini Bharat, Tata Institute of Social Science Director, our founding institution, for constant guidance and support to all of us. Ms. Soledad Herrero, Chief of Child Protection UNICEF, we thank you for being with us today and for UNICEF's support to Childline from our founding stages through our growth and as we complete 25 years. Thank you, Ms. Kusuma Hariprasad, for your sharings. We thank all our governing board members and Mr. Supulam Kumar and Ms. Mary Venus Joseph. Respected session chairs and panelists, we are overwhelmed by your expertise and insights. We are grateful to all our esteemed speakers for enlightening us with your inspiring and motivating words. We also take this opportunity to extend our deepest gratitude to all our Childline partners and the team on ground across the country who have kept the ethos of Childline to its highest level, and they do deserve a round of applause. We also extend our heartfelt thanks to all the friends and well-wishers of Childline. We owe thanks to all those who are viewing live streaming and joining us. Wholeheartedly, I must express gratitude to Ms. Jeru Villenoria, Childline's founder, for being with us today, and we look forward to seeing more of your Jeru. We also thank all our former colleagues of CIF for making time out for joining us. As it is said, once in Childline, you all are Childliner forever. We are thankful to the Executive Director of Childline India Foundation, Dr. Anjaya Pandari, all our colleagues who have worked hard to make this event a memorable one. At this milestone of 25 years, we, the Childline family, spread across 602 districts, reaffirm our commitment to the protection of all the children of India. We rely on your continued support and collaboration as we step forward into next 25 years. We thank you all once again. Have a good evening, everyone, and do keep well. Thank you very much.
Yeah, Susavan, thank you very much. I just wanted to take this opportunity to introduce, say a few words. Dr. Venkat Rao, he was my teacher, he was my mentor, and today I've taken up this profession because of his motivation way back in 35 years back. So thank you very much, sir, for coming on the platform and speaking to my colleagues, my Childline directors, and the the entire child protection, the cadre on the ground. Thank you very much, and we'll look forward many more occasions. Thank you so much, sir. I just wanted to deeply express my gratitude for that.
Thank you very much, Anjaya. Thank you very much.